Institute of Management. We are today hosting the 4th annual Healthcare Management Conclave. The theme of the conclave is digital metamorphosis in healthcare. It is an absolute pleasure and honor to be standing before you all today as we gather here to discuss and deliberate the digital metamorphosis in healthcare industry undergoing nationwide. The conclave serves as a platform to insightful discussion and meaningful deliberation on this transformative journey. On behalf of the organizing committee, I would like to express my gratitude to all the distinguished guests, experts, doctors, researchers, and delegates who have taken the time out of their busy lives to be a part of this momentous event. Your presence today demonstrates your commitment towards the improvement and advancement of healthcare, as we are grateful to your support. In our Vedas, I quote, Vidya dadati vinayam, vinayat yati patratam, patramat bhava dharnoti, dhanam taram tatasukam. Knowledge gives humility. From humility, one attains character. From character, one acquires wealth, and wealth helps us to follow good deeds, giving happiness. Today's conclave holds an immense significance not only to our healthcare community but also to the society as a whole. Technology is being leveraged worldwide to deliver service to citizens in all the domains, including healthcare. The pandemic accelerated the growth of digital transformation in healthcare. In response to this, Government of India launched the Ayushman Bharat Digital Mission in September 2021. The purpose of ABDM is to establish a national digital health ecosystem that is integrated and effective and inclusive. Work open protocols and content artificial enable citizens, public and private healthcare providers, to digital innovators and other stakeholders to come together and drive an equitable digitalization of healthcare across the country. ABDM provides us with an opportunity for different stakeholders such as the citizens, academicians, healthcare providers, the industry, the government, and the forced collaboration across the industry to innovate and generate knowledge based on economy along with shaping the future of healthcare. Needless to say, it is a watershed moment for India. At the junction, JIM is collaborative with the Directorate of Health Services in Goa, organizing the conclave to bring the representatives of the government, industry, and academia to help us have a constructive role they can play and digital metamorphosis of Indian healthcare that can contribute in meeting the goals and the sustainable development. The conclave will start the panelist session across two panels discussing. The first panel is the industrial panel deliberating on the topic of role of industry in digital metamorphosis of healthcare, and the second panel is an academic panel that will deliberate on the topic capitalizing the digital metamorphosis in healthcare for research and innovation for knowledge economy. We have carefully selected the renowned speakers and experts who will share their expertise and opinions based on their vast experience and knowledge. This year, the conclave is especially special to us. We are delighted to share the exciting news that this year's event coincides with the momentous 10-year anniversary of Healthcare Management Program. It was the visionary through Professor Ajit Parulekar that led to the establishment of this program, which has since grown to become one of the finest healthcare managements in India. We take immense pride in commemorating 10-year milestone for HCM program in conjunction with the esteemed conclave. Lastly, we earnestly encourage everyone to take active part and engage in discussion, seizing network and opportunities, and utilize this platform to share your invaluable knowledge and ideas. Let us join hands to ensure that conclave becomes an exceptionally productive and enlightening event for all of us. We would like to invite our guest of honor, Sanjay Bihari, our beloved director, Professor Ajit Parulekar, our dean, Professor Venkatesh Naga, and our HCM chair, Professor Ajay Vamadevan, to join us on the stage and aid us in traditional lamp lighting ceremony. This ceremony symbolizes the spreading of light and knowledge, and we would like to honor to have all of you as a part of this auspicious occasion. So please kindly make your way to the stage and let us begin with the ceremony. Thank you. Dignitaries, kindly take the seat. We request Dr. Ajit Parulekar to deliver the welcome address. Dr. Parulekar is an accomplished academician renowned for extensive experience in both corporate and academic realms, currently serving as the director of prestigious Goa Institute of Management. He holds the position of Professor of Marketing with the Healthcare Management Program. With a diverse background in brand management within the pharmaceutical industry, Dr. Parulekar brings a unique perspective to his role. Joining GIM in the year 2000, Dr. Parulekar has played a pivotal role in shaping the institution's success. He spearheaded the establishment of healthcare management in 2013, showcasing the commitment to healthcare addressing the evolving needs of the industry. Additionally, he has actively contributed to various areas of academic administration, including program management, admission chair, placement chair, and chair of alumni affairs. With the wealth of industrial experience and outstanding academic contributions and commitment to drive positive change, Dr. Parulekar continues to excel as a visionary leader, inspiring students and fellow academicians at GIM and leaving a profound impact on the field of management education. Over to you, sir.
A guest of honor, Dr. Sanjay Bihari. The chief guest for today will be arriving in another maybe 20 minutes, the Honorable Health Minister of Goa. He also has a lot of other portfolios, Shri Vishwajit Rane ji. All our distinguished panelists, Professor Ajay Vamdevan, Program Chair for the Healthcare Management Program, the entire HCM faculty, all my other faculty colleagues, staff members of GIM, dear students, guests who've come here, dear students. Welcome to the 4th annual Healthcare Conclave of the Goa Institute of Management. This is also a time that, as our student mentioned, this is also a time that we complete 10 years of the Healthcare Management Program. It was, I think, somewhere in 2012 that we had a lot of conversation among the faculty, among the board, that it made sense to come out with the healthcare program because healthcare is quite specialized in that sense. It was a big risk at that point in time because there's nobody else who's running healthcare management program. I won't name the school. There was one other leading school that had tried running a healthcare program and that had not worked quite well at that point in time. We knew that we were taking a risk, but we thought that it was extremely important that we had a healthcare management program. Now, it's not that there were no other programs at that point in time. And AIIMS has been running a hospital administration program for, I think, more than 25 years now. So there were specialized programs that were for hospital administrators, for people in pharmaceutical sales and marketing, but not really an MBA program that was diversified, looking at a diversified healthcare industry, being primarily a management program, but just laid in the context of healthcare. So being able to look at, the agency theory, for example, in healthcare becomes an extremely important part. So looking at the nuances that are required in healthcare, and when we looked at healthcare, generally we realized after we did this, when you say healthcare, most people think the delivery of services on the healthcare side. When we looked at healthcare, we looked at a completely diversified healthcare portfolio, which would include the producer sides of pharmaceuticals, devices, of course, hospitals, primary care, delivery of health services, healthcare financing, consulting, IT, analytics, looking at a completely diversified portfolio. And of course, it was a risk. At that point in time, we also realized that, so one thing that current students don't know is while we were charging around a fee of 10 lakhs to all our other PGDM programs, this was completely equivalent. We realized at that point in time, because the new program, that was the industry that was not willing to pay in that sense. And therefore, we started at 6 lakhs. And over a period of 5-6 years, we increased the fees of this program to match. So I know the initial batches, we had this pleasant problem of students asking, but why are our fees low, right? Because they felt it was in some way probably inferior. Today, 10 years later, I think we have all of us, the healthcare faculty and the entire institute. I think we have a lot of sense of pride to say we've been able to establish a new vertical that makes a lot of sense. Today, I know that there are 4 IIMs that now offer this as a full-time program, and there are several. So ABC, all 3 of them offer it as an executive program, I think, of a 1-year duration. So I think we can say quite proudly that we were trailblazers in this, and this is something that's caught on. We have excellent feedback from industry, from people who teach on this program. So congratulations to the entire GIM community on this. One other small, yeah, so I think we need one other kind of small, what do you say, benchmark for us, not benchmark really, an occasion for us is we're just inaugurating this auditorium. So this is the first ever event we are having in this particular auditorium. Looks like it's come out well. And I think we should see it looks like an August start, and therefore we should have a lot more events that will happen at this place and help us in whatever journey that we have towards academic excellence. I'm not going to talk about what I had written down for the health minister. When he comes, I want to do that in his presence. So I must just say for all our speakers here that generally the entire ministers, secretaries in Goa are quite unlike what you'll see anywhere else in the country. So they generally are willing to put protocol to the wind. You'll see that when he comes here, and that's true not for him, it's true for the chief minister, it's true for all the secretaries also. And therefore, when I called him, I said, sir, we're getting late. He said, no, please go ahead, please start. I'll join in as and when. So we'll wait for him to come. He also speaks really well. A couple of the speakers here would know that he's spoken earlier also at the Conclave. And we do some work with the DHS, with the Goa Medical College, and we have quite a lot of state support in that sense. I'll also thank, in advance medical science and technology. It's amongst the top 5 medical research institutions in the country. So thank you so much, sir, for taking time and to be here. We really look forward to your keynote today and also your participation in the panel discussion later in the day. So this year's Health Conclave, this is the 4th of the Health Conclave we're doing. It's on a topic that I think is really exciting. It's on digital metamorphosis in healthcare. And what are the implications as a result of, what are the kind of opportunities and challenges that will come as a result of this digital metamorphosis? We know that, all of you do know, because most of you here have a strong connection to healthcare, and students who are here the first years, you've just started your journey in healthcare, because I know around half of you don't come with a previous health education background. But I'm sure all of you will realize that digitalization of healthcare is showing a lot of promise. A lot of things are already underway, and it's not something that's like usually technology would be. That it's in the research labs that we are not aware of. There's a lot of democratization of this and goes onto our phones, our smart watches and stuff like that, to so many different aspects of our life. And therefore, that's something that we thought would make a lot of sense to have this conversation today. And I'm sure that today's deliberations are going to be both inspiring as well as extremely exciting. And I hope it will inspire many of our students to either do some startups of their own, to kind of read up a lot more, to be excited, inspired about some of the kind of things that are talented speakers, and kind of, we have a multitude of different speakers we've got from different walks of life. I hope you will have some inspiration there that will have at least some of you see what are the paths that you want to follow in healthcare. I thought I'll talk a little bit about this topic. And so whilst we have a healthcare program, we also have a data program, data analytics program. And the reason we're doing this program, because I think that's something that's extremely important today for a business school. We know that technological disruption is driving business. And with the technological disruption, not just technology, but the impact that technology has on business, and therefore the kind of changes that happen in business practices. So with regard to digital and healthcare, that metamorphosis, I think today data spans, kind of the entire cycle from predisposition of people to a particular kind of health state. I wouldn't necessarily say an illness, but to a health state. The diagnosis, monitoring, cure, wellness, everything on the clinical side, and of course, umpteen different interventions on the business side, right? So interventions relating to things like reimbursement rates, to health technology assessment, to logistics management, to manufacturing, consumer insights, follow up on patients, variety of different things. All of these are things in which you find today data plays a role, and therefore it has both financial and strategic implications, and of course it has implications on the clinical side. And therefore that's one of the paths as such in terms of digital. The second is what's happening in this democratization part, is you find now data is being created real time on the devices that we are wearing on ourselves. Yeah, so you'll find, and when they're doing this, the power of our mobile phones and our smartwatches are being enhanced greatly by a lot of research that comes in new types of sensors, right? So going from things like accelerometers and gyroscopes, every year you find new kind of sensors, And those sensors are revolutionary in the sense that they're not replicating diagnosis in the way it was done in the past. So what was a biochemical test is no longer a biochemical test and becomes an imaging test, right? And vis-a-vis, you could have a lot of those kind of interventions happening, and therefore our personal devices today, what they're able to do is they're able to do a lot of work for us on monitoring our overall health status without adding a cost. I mean, most of it is on the variable cost point of view. There's almost no cost, or there's a very, very marginal cost. There's a fixed cost that, of course, the device is going to be more expensive as you're going to get more sensors and more software getting in. So I do see that these personal devices will have a big potential to play in leading, the way we are going to look at our own personal health. So I know that my watch can tell me not just, how many steps I walked and things like heart rate. It can tell me the oxygenational level in the blood, and if I get some new widgets onto it, it should be able to tell me a couple of other parameters that are important to me. Right? And I see that's something that's just going to keep on, adding on more and more parameters as time goes by. And I'm sure a lot of you can envision, therefore, when you're looking, just for example, look at glucose levels, and when you look at glucose levels are just fasting and postprandial, and today you are able to get those levels, at different points in time. I think it can do what a Holter does for cardiac. I think that's really what mobile phones can do. And I think that's therefore the second. So one is data. The other thing is personal devices, and therefore real-time data coming from each of us without, and non-invasive in most of the cases. And third, and the big one that I think, overall health data stack. So this health data stack is going to power entire health policy. So policy creation, performance monitoring of various kind of policies or various kind of initiatives, course correction wherever there's necessary. And with that health stack, there's this whole enabling framework that we're looking at in terms of this ABDM or the whole, ABHA IDs. Coincidentally, my daughter's name is ABHA, so I have like a personal connection there. So this can democratize really the use of clinical data to benefit individuals, as well, of course, to benefit the overall health system. So all these three streams that I'm talking of, and I'm limited in my understanding. I'm not an expert in this area, but we have a lot of experts here. They'll add on to those streams. I think then all of these together, they provide a basis for artificial intelligence. I mean, once you have this kind of data that's available, and you can use artificial intelligence to be able to allow for analysis of very large, diverse, and complex data. And this data would be health as well as non-health data, to be able to identify trends, identify patterns, relationships that will go way beyond what human learning and ingenuity can cover. There will be a lot of things that human ingenuity and learning can cover, but I think there are a lot of other things which you'll be able to just get because traditional science has not yet made those relationships, but data will just throw up stuff like that to us. I think therefore all these three parameters or all these three factors will help us to do a lot in terms of AI. So this digital transformation or metamorphosis is what will provide opportunities in provision of better diagnosis, better medicines, better devices, more efficient delivery of healthcare, better profitability, hopefully, better healthcare, wellness. And I'm sure that in addition to, so I can see faculty coming from diverse streams, and that's really what's happening. Healthcare is not really being driven today by healthcare professionals alone, but people who understand data, business strategy, variety of things like that. So I can see a diverse audience here who's sitting here and waiting to hear from the experts. So last thing before I finish my welcome address, my congratulations to the entire healthcare team, led by Professor Ajay Vamdevan, for organizing this much needed and, I must say, forward-looking conclave. Thank you once again to all our speakers for making the time. I know all of you have very, very busy schedules, and look forward to a fantastic, day today. Thank you.
Thank you, Professor, for your pearls of wisdom. Ladies and gentlemen, it is with great pleasure that I introduce you to Professor and Dr. Sanjay Bihari. He is the director of Sri Chaitra Tunnel Institute of Medical Science and Technology, an institution of national importance in Thiruvananthapuram, Kerala. Prior to this, he served as the professor and head of Department of Neurology at Sanjay Gandhi Postgraduate Institute of Medical Science in Lucknow. Professor is an accomplished academician, Having conducted over 8,300 neurological procedures and edited 16 neurology books, including 4 bestsellers with TAME publications. He also has applied for 7 patient and has 367 public MedPub indexes and 142 chapters in the books. In addition to his academic achievements, Doctor has been a visiting professor at several renowned international universities like Japan, Switzerland, USA, and Portugal. He has been a visiting professor at IIT Kanpur and National Institute of Neuroscience in Calcutta. Professor Bihari is a Fellow Academy of Medical Science (FAMS) and Fellow American Association of Neurological Surgeons (FAANS) and has been awarded numerous accolades, including the James Tyson National Award for Best Biochemical Invention in 2017 and the Best Paper at World Federation of Neurological Societies in 2022. He is also a member of editorial board of 12 journals and chief editor of Neurology India. We kindly request you to address the gathering, sir.
Just show me your receipt.
Good morning. First of all, I'm grateful to the Honorable Chief Guest, Dr. Vishwajit Rane, Health Minister, Government of Goa, who's soon going to join us here. And I'm also extremely grateful to Professor Ajit Parulekar, Director, Goa Institute of Management, and Dr. Ajay, the Chairman of HCM, for kindly inviting me for this, on this occasion. I'm really grateful to the esteemed members of the academia, the leaders of industry participating in this conclave, fraternity of Goa Institute of Management, students and other participants, ladies and gentlemen, for being here. This honor of being a part of the 4th annual Healthcare Management Conclave with the theme of digital metamorphosis in healthcare, opportunities for industry and academia in transforming India, which is organized by the GAM, is a privilege to attend. It's always wonderful to come to the beautiful state of Kerala, and the rainy season makes it even prettier. I congratulate the GIM for maintaining its peak position in the national rankings in several domains. Congratulations to all of you for your combined effort. I also congratulate you for completing 10 years of distinguished existence, and also for being for this new auditorium that you have just made. I've been a part of the government hospital setup. I've been a clinician, I've been a neurosurgeon for about 40 odd years. I was in Jaipur, then I did my MBBS and MS there, then I went to SGPGI Lucknow, then rose through the ranks. I was head of the department there for 7 years, and then suddenly changed over. And now I'm heading Sri Chitra Tirunal Institute of Medical Sciences. So I asked for your permission to share 3 messages based on my personal experience. And I have a disclaimer to make. Some of them may be slightly out of sync with the prevailing ethos. And I sincerely apologize for this misdemeanor. But you know, from a government perspective, I need to tell you about a few things which are going on. The first of them is, healthcare is moving towards personalized and preventive paradigms, utilizing universal technologies which support real-time self-care and monitoring. The coronavirus pandemic increased the need for ongoing digital health advancements. So the traditional face-to-face consults were found to be dangerous because they could propagate infection. So this emphasized the need for virtual consultation technologies. I was actually, as head of Department of Neurosurgery, entrusted with establishing the network of telemedicine in the state of Uttar Pradesh, trying to link up 52 districts of Uttar Pradesh with 3 major hospitals. Sanjay Gandhi Postgraduate Institute of Medical Sciences, King George Medical University, as well as Banaras Hindu University. I started this job with a lot of trepidation. To my surprise, however, the efficiency with which the patients were transferred, information about them collected, disseminated, and analyzed, and with confidentiality maintained, and advice from doctors in the periphery sought on telemedicine, made us all realize that telemedicine had now become firmly entrenched in the arena of healthcare. With a consistent outreach program established at no additional expense, with a dedicated team, and a reasonably speeded internet, a digital knowledge revolution was taking place in the state. I was amazed at how everyone, even in remote locations, rose to the occasion and immediately took to technology. And we were able to save a lot of lives, and we were able to triage all our patients. However, reality is that phenomenon which, when you stop believing in, doesn't go away. I'll repeat it. Reality is that phenomenon which, when you stop believing in, doesn't go away. Sadly, immediately after the pandemic was over, the entire network was dismantled, despite my many protestations. I realized one lesson while this dismantling was going on. It was not the state administrative setup that was actually responsible for the rapid fragmentation of this wonderful network that was established across the state. It was, in fact, the doctors, the health administrators, and the members of academia actively participating in it, who were the first ones to forsake the excellent work they were doing, not for a moment realizing the significance of what they had achieved. And their plea was, this is not my work. So the first message is, the focus on education should be on ground level implementation of actual policies, and more importantly, on doggedly pursuing them until they become firmly entrenched as a part of one's life and of the community at large. Focusing on real world challenges at the ground level is the need of the hour. My second message is that a silent revolution is taking place across India. No longer is the society content with educational pursuits for the sake of getting a higher qualification or for the sake of pure learning. The focus suddenly is on discovery, translation, and application. Thus, the knowledge has shifted from pure academic endeavors to application of knowledge for the development of tools, techniques, and devices. The focus, we can all proudly state, is on a self-reliant India. The current annual requirement of medical devices in India is worth about 30,000 crores. Of this, only 20% of the devices are made indigenously. If our country has to be less dependent on imported products, then the Indian medical device industry must considerably expand. According to Digital Health India document, the global digital health market was valued at $211 billion US dollars in 2022, growing at compound annual growth rate of 18.6% from 2023 to 2030. In the Indian context, this digital market is 12.2 billion in this year, 2023, and is projected to reach $25 billion in 2027, with the compound annual growth rate projected as 20.4% for India. Based on this clarion call for a holistic approach to medical device development, the gap that exists today in the development of indigenously produced medical device technology needs to be bridged. During this exciting time for medical device growth, digital technology takes the upper hand. From maintaining electronic health records to electronic remote thera-diagnostics. What is thera-diagnostics? Therapeutics and diagnostics. To wearable, artificial integrated mobile and handheld devices, to usage of medical technology, and to the Internet of Medical Information. Digital metamorphosis has reached from the pupae to the beautiful butterfly stage, being an integral part of every medical device. There is only one catch to it. If we ask ourselves, are we patriots? Each one of us will vigorously nod our affirmation. Henry James once said, I think patriotism is like charity. Charity begins at home, and patriotism also begins at home. We have very sophisticated machines in the hospitals, brought from several international companies. Most companies in India would prefer to import international products and sell them at huge profits rather than support at least some gadgets made by Indian entrepreneurs. The startup companies also have a major role to play in this patriotism saga. The focus is simply on translation. The problem is that they have not adequately tested the devices which they have translated. And the result is that they are not bringing out high quality products, as this particular endeavor requires a lot of time and expenditure. The result is a half-baked product that often goes out of order. There is also hardly any input from the international experience that we have gained over the years, mainly in standardizing these startup companies to make quality products. And therefore, I realized the value of testing when I came to Sri Chitra Tirunal Institute for Medical Sciences. It has 3 wings. One is the hospital wing, which focuses on cardiac and neurosciences, looks at patients, does treatment. There is a biomedical technology wing, which actually for the last 40 years has made several devices. And the third one is a public health wing, which actually looks after public health. Welcome, sir. So now there are 3 wings in the hospital. Unless, this is a very important point that I'll make, no matter how sophisticated the device is that you make, unless the doctor starts using a medical device from India with complete faith in it, it will never be successful. Therefore, each one of us has the seminal responsibility to improve as well as standardize our products and utilize them with pride and with the innate confidence that they will not fail. This is a major responsibility that we have. The third message is related to practicing reciprocity. What is this term reciprocity? It is the core value of cooperation between people not related to each other. I have been invited to several institutions across the country ever since I've taken charge at Sri Chitra Tirunal Institute. I have realized that often I find scientists and engineers duplicating their products, working out on nearly the same products, and they don't even know that they're working on nearly the same products. This basically occurs because of 2 things. First, it is extremely difficult for us to extricate ourselves from our cozy cocoons and an environment we are comfortable in and immerse ourselves in a situation that is completely aligned to us. It's very difficult to do that. The second very important thing is, it is very difficult for us to associate ourselves with people who are engaged in activity completely different from that of our own. An engineer will work with an engineer, a management person will work with a management, unless there is a professional relationship. Or a scientist will work with a scientist. But it's very difficult for all of them to come together to focus on one particular aspect. For example, if an engineer spends 1 month in the operation theater, he will spontaneously come up with digital device-related solutions that the surgeon will never imagine are possible in hereto completely unexplored areas. This is immersion. And this interdisciplinary cooperation creates magic. Therefore, my third message is, consciously seek out people who are engaged in completely different activities than you yourself are involved in, the insights that will emerge from this union will be path-breaking. The close cooperation between academic institutes, hospitals, industry, health administrators, and non-governmental organizations gathered here, all of whom are working towards the goal of digital medical technology development, will, I'm sure, result in some outstanding initiatives for our country. The presence of so many leaders in this field, in this brainstorming session, is a testimony to the fact that there is now an increasing awareness of this immense need to cooperate. Emerson once said, "Mind stretched by an idea never returns to its original dimensions." I sincerely hope that this conclave will help to ignite minds in the field of digital device development and take our initiatives and actions to newer dimensions. I wish this conclave my very best wishes. Thank you very much.
Thank you, Dr. Sanjay Bihari. A big thank you today to our visionary health minister, Shri Vishwajit Rane ji, for taking time out from his busy schedule. Not only does he have the health portfolio, he has several key ministerial portfolios that he handles. Thank you for being the chief guest today and to inspire our students. Most of you would be aware, but some of our students wouldn't. Under his leadership, Goa leads the country on several parameters as far as the health system is concerned. It's under his leadership that we have a truly universal health coverage. When I say truly universal, in most parts of the country, it covers only certain people with certain income brackets. But Goa is the first state to look at a truly universal health coverage irrespective of income. And that's something that happened during his time as the health minister. Also, we have very recently operationalized a state-of-the-art super specialty hospital at the Goa Medical College. And of course, you would be knowing that the state performs exceptionally well on several health outcome indicators, including things like the IMR, MMR, and several other health outcome indicators. So he's brought in a lot of fresh energy and new initiatives to healthcare as such in Goa. And therefore, who better than to talk about digitalization from the government's point of view. The minister has been very supportive of the Goa Institute of Management and our healthcare program. We collaborate quite a bit with, so we do things with the Goa Medical College, with the DHS. Our students, as part of their KYHP program, will go and visit a lot of the public health infrastructure in the country, in the state, including the whole PHC network, CHCs, district hospitals, the Goa Medical College, and variety of these. And people on the system give them a lot of time, a lot of hand-holding and things like that. So we're very thankful. And we look forward also to working with, our faculty in healthcare, they work on health policy in several states in the country. We'd like to do even more than what we currently do in Goa. Goa has the opportunity of being a pilot state because it's small. And therefore you can replicate, you can pilot here, and then it could have a lot of implications, at least for the small states in the country. And therefore we look forward to continued and enhanced support from the minister to take this forward. Yeah. Yes, sir. So with that, I'll invite sir to give his chief guest talk. Yeah.
Thank you so much. Mr. Ajit Parulekar, Director of the Institute, and other dignitaries on the dais, and all the students and dignitaries sitting here. I was just very inquisitive to know who all are here today. So somebody mentioned Madam is from Google Health, somebody is from the Bill Gates Foundation, somebody is representing Philips, somebody is representing KPMG, somebody is representing some other institution. I was sent specific areas which I need to speak on, but I think I'm just going to speak in general so that it interests the dignitaries who have come to speak and also the students who are here from Goa Institute of Management. Dr. Ajit Parulekar mentioned to me a couple of months back, and actually I forgot yesterday. I had some personal emergency, a personal thing which is going on. So as a result of which, that has consumed more time and consuming more time on a regular basis. So basically, if you want to know what, I'm very happy here to be present for the 4th Healthcare Management Conclave here with all of you. But actually, when you want to do something, and specifically for the students, then I'll address the dignitaries also, because their inputs also are very important if you actually want to drive a state in a particular way. As I was coming here, I was just trying to give you one example, is what's happening in the state of Goa. And many times through your real life experiences, you generally try to understand how can you make a change in society, and how can you make a change and be a change that is beneficial to the people of the state of Goa. Unfortunately, I believe that many times I believe it is only the rich earlier used to be accessible to healthcare. And it is a truth that there are points and situations when a person like myself also struggles to get a particular type of system in place to address a particular issue. And then I realized that what needs to be done in terms of policy. There are insurance companies that are there who basically have specific areas which they insure people. But Goa, we are a little different. Goa, we have, before going on to the digital and innovative steps that the government of Goa has taken, we have gone out of the way to see even birth defect deformities and all are insured under the Goa medical claim, because those are the things which are very much important, because people get drained and financially they get totally drained. There are some issues, areas which no other state is insuring, giving any kind of a medical claim or a reimbursement, but Goa is the only state that is dealing with that. Today, when we talk about digitization of healthcare, innovation, how do we use innovation and how do you use it for the benefit of the people? I was telling Dr. I don't know whether I mentioned to Dr. Parulekar, but I would like to share with you. I was in America and in New York, I was having a cup of coffee. Somebody mentioned to me that there's this article there's a startup. And this startup was a company called iBreast. And this iBreast works on the tactile technology. All of you must be knowing. And this is generally with Kiran Shah Muzumdar and Dr. Ranjan Pai. All of them have invested. So I was sitting down, so I said, let me send this guy an email and let me talk to him. I was just talking to their team only. And I said, let me just see what is happening, what is this iBreast. I was very inquisitive because Goa, the rate of breast cancer is going very high. And as a result, to bring it under control, bring it and monitor it and try to see that we address these issues on real time and am able to take action, I just called him. So he told me that this Mir, who's now a good friend of mine, he said, you know, it took a New York Times article for a minister from India to come and get in touch with me. I said, you should be fortunate that I got in touch with you, because you will get prominence after you come and tie up with my state. So now we have tied up. I talked to him, I explained to him what we are looking at. Yes, there were hurdles, because when there are proprietary kind of protocols, it becomes very difficult from the government side for us to take that forward, because government systems, government's thought process is a little different. So we took them on board. And today in real time, we know which machine is working in which place, who's using which machine, what tests are being done. And we have already covered 1 lakh women over the last year and a half, and all the database that we have got about these ladies who have been already scanned. And then we decide, after there's a team of doctors that decide that who has to go for mammogram or who has to go for further investigations. And I think we have done well on this front. We have several innovative steps that Goa has taken. I don't know, most of the students, like Dr. said, Mr. Parulekar said, is that have gone to the PHCs, CHCs. It's a challenge running a health system in a state. It's not very easy. Sometimes you have so many obstacles that you have to overcome, but that you need to overcome with proper justification, and you should have a clear-cut thought process. What are you looking at and what do you want to target? Today, Goa is undergoing some sort of a total change after COVID. Profiling of people also has changed in the state of Goa. And as a result of which, today, with the help of the Honorable Prime Minister, Shri Modi ji, we have been able to get the super specialty hospital. Now, just having a hospital is not going to help you. Now, what is going to come in that hospital? Now, luckily, we have tied up with Dr. Amit Maideo, who's going to put up a state-of-art gastro facility in the super specialty hospital. We have now tied up with a couple of team of doctors who's putting up robotic surgery, a department of robotic surgery in Goa Medical College. In addition, Goa is the first state where we are going to be giving free IVF treatment for the women, where we see that a lot of women get taken for a ride when they go outside the state of Goa and in neighboring states in this treatment protocol. So everything in this state, every aspect of an individual is all monitored. We are trying, like what Dr. Parulekar mentioned, is that digitization plays a very important role. Yes, digitization plays a very important role Today we have shortage of doctors and specialists in certain fields, so we have created common dashboards through which we are able to interact with the other peripheral hospitals, and then that type of treatment protocols to those doctors, because we don't have that type of specialists. Today we are on the verge. Digitization is there. Digitization of records, having a seamless transfer of information from one doctor to another, all that is very important. Having AI, today I was the one who made a presentation in Delhi when I had gone recently to talk to the union minister, and also submitted a small docket to the PMO, is that to consider Goa to be a AI hub for diagnostics, and in that area we need to move forward, and that is very important. Today, all of us know, unless you make some sort of a headway, and you decide that this is going to take over the whole area of science and playing a very important role in today's times. In some places they are still on research mode, some areas they are talking about AI in its own way, trying to diagnose a patient's report or analyze a person's report. And I think in some case studies which they have shown, it's so clear cut, in a very methodical manner you get outcome. It is very important that a small state like us, like what was just mentioned, that for us to implement these type of projects and make Goa, which is a very small state, we are a small state, we are a very progressive state, we think little differently, and our outreach programs also are pretty good, and lots needs to be done. I'm not saying we have done everything, and I mean we need to boast about everything that we do, but yes, we want to start this AI hub in the state of Goa, and I think we will be getting backing from the government of India in terms of diagnostics, how to move forward. It is important for us to think differently. And also I was just talking, as I was coming here, Dr. Parulekar will tell you, morning I was speaking to him, is how, because what happens, sometimes you get consumed with so many things, what's happening around you. You need to understand, and we were just trying to see what is the additional things that we could do together with Goa Institute of Management. And it's important also for us, for you to know that, there was a study that was carried out, and how do we reach out to them? There was a study carried out as far as stroke patients are concerned, that beyond the golden period, you can still thrombolize the patient. Then we are in the process, unfortunately due to COVID, we couldn't sign the MOU, but we are in the process. University of Miami was one of those institutes which had initiated the research on thrombolizing the patients beyond the golden period. So we are signing now, concluding it now. And in addition, we have started thrombolizing patients at peripheral areas. We are trying to save the patients on time. And basically also facilities, you must understand that Goa is one of those states in the country where even coiling is free of charge. Putting a pacemaker, you go outside Goa to any state, pacemakers, leadless, those new pacemakers also are being given free of charge, which cost something like 8 to 10 lakhs of rupees per patient. So there is no compromise as far as the patient care is concerned in the state of Goa. We have decided that in terms of what we want to do is like HMIS and all, these have become like usual stuff. But why? What HMIS means? Just not keeping digitization of records in the hospital. But how do I link up all my PHCs, CHCs and see that the people don't need to move from those areas to always coming to the tertiary care center for help and care, or district hospitals, but what is it that we can provide to them in those particular areas? Goa, as far as we are concerned, eye breast screening is one of the important things that I believe which we are trying to do and taking it forward. We have roped in the top-notch doctors who are there to try to see that we are able to manage the super specialty hospital in such a professional manner that people of the state of Goa don't have to go outside the state of Goa. I, for one, believe accountability also is important. Today, unfortunately, when we talk of digitization, we talk of everything. We talk of every aspect of digitization we take. But definitely, to some extent, you require manpower also. You require that type of specialists and doctors also. So we are one of those states which is going to have the highest, in terms of our size, the highest output of technical staff such as nurses and medical colleges also. We are in the pipeline now of attaching it with the Niti Aayog's new policy to have additional medical colleges in the state of Goa attached to the district hospital. So we are working around the whole, creating that type of ecosystem which is required. Whenever I think sometimes, is that how does a poor man receive this type of care and help? So we now started satellite OPDs. Now they have, without any difficulty, we are able to identify patients that require care, and we bring them to the tertiary center and we give them that type of care that is required. Since all of you are present here, this is the only state that gives all medication, which is life-saving, also free of charge. chemotherapy from onwards to every type of medicine is given free of charge. And the reason why we are doing this is because people cannot afford it. Many times they go to Tata Memorial and then they find that they have to do so many cycles and then come back and then the doctor will evaluate them. And then what happens? Then he cannot afford it. And as a result of which we have been doing, taking steps in this direction to see that Goa leads the way. And it's not only Goa is doing this because it wants to lead the way and boast about what it's doing, but we actually care for the people. So we want to see how to make life easy for a person already who's traumatized, families already getting drained with the disease and different type of disease, what they have in terms cancer can really drain a family out. But also I want to share with you that we are in the process today. And again, with the help of the Honorable Prime Minister, we were lucky that we got a regional cancer center, which I have now converted into a state cancer institute, which is we are spending about 270 crores, which will be having all the treatment protocols, and we are in the process of tying up and signing a MOU with Tata Memorial. It will be managed by Tata Memorial. The state will give the funds that are required, and that is how we want to move forward. When you want to progressively move forward and you say that you're a progressive state, then you must take the top specialists and the best of institutions that have credibility and good credentials in order to see that you're able to do something different. When I say that we are giving everything free, we are giving actually virtually right from your OPD, right from cholesterol reduction medication to blood pressure medication to insulin. Now again, when we procure insulin, we are keeping a total, we have a total registry which we maintain, not to only give medication. Procurement is not done only because there's a L1, L2 and all those things, but procurement is done with the whole pointing system that we have done, where we say that give us the whole program that you have through they have these education and research foundations. How will you help us train our manpower? How can we have multiple food clinics? How can we go ahead and tell us the whole so what else they're going to share? And also to see how the intake of insulin of that particular patient is reduced. So basically all these things we have factored in. These were tendering processes are not known to the departments, and government doesn't think like that because we generally procure. We go and procure on L1, L2. It doesn't happen like that. Today, even on the diagnostic, somebody is here from Lal's, your company, which is again a top company. Unless you have the huge the equipment which churns out that many number of tests, then how does an institute and a hospital run? Today, in a Goa Medical College, every test that is not available, I think barely, maybe few, handful. But most of the testing equipment that we have got those ARC and other machines from Abbott's which are running in the institute. And we have gone on upgrading ourselves. And luckily with today genome sequencing and everything. Today, even if you look at cancer, when you talk to a doctor who is specialized in a focused cancer therapist, the doctor first tells you that she wants to do a foundation 1 test. She wants to do a genome sequencing, and she says that I want to know the good pathways, bad pathways, so I can accordingly handle the patient and see that I give the best outcome as far as treatment protocols are concerned. So unless you go into depth of all these things, all of you are management students. Today, everybody is looking for having good minds working with them. Governments also are changing. In a government field also, in a government area also, we want to look beyond what we already have. We need people who can give us advice and who can, there's a young girl, I was telling Dr. Parulekar, that Neha Sangvi, she's a scholar. She's doing a medicine. At the moment, she was in the US and now she's gone to, and suddenly she touched base with me through some common friend. I have commissioned her to study, and also I have talked to Mr. C.K. Mishra, who was former Secretary Health. I have put them together, and I said, you may be young, but young brains are the best to utilize. And I told her, so always she comes and she corresponds with me, she shares her experiences. Now at the moment she's in the West Indies. She is sitting with him and she's drafting basically the whole health policy for the state of Goa based on what the other states are doing. That's why we were just talking in the morning, is that we need to take Goa Institute of Management also on board in addition to see, because what is it that you want to do for the state? How do you want to progress? How do you create this research, have separate money dedicated only for research? Doctors many times think that they need to only treat the patient and move forward in life. It's not happening. Students also should realize in the medical college, I have told them that extra incentive will be given to people who are able to present research papers. It is very important that certain money is allocated by the government for research. Yesterday I was in a forest department meeting, it's not related to your subject, but I told them, what are you doing? You need to tell me exactly how much money and how much of application of mind is going into research in the forest areas. There are several research organizations all over this country. I was recently in the Arctic, and I went and saw our scientists in Himadri, which was there, trying to understand. They were just explaining to me on the aspects of global warming, and suddenly I bumped into somebody. I had just gone on my photographic expedition, and suddenly I bumped into somebody who was from Goa. And that person mentioned to me, you know, that this is all what we do. And they said that here, if the glacier melts, and the glacier, excessive glacier melts in those areas, then it has an impact on your climatic condition in your particular area, which I didn't know. They said there's something called the tunnel effect and other things. I didn't go into detail because I was on some other things, so I was just listening to them. But you know, I have that inquisitive mind, which you all should have that type of an inquisitive mind. You know, try to go and, you know, try to go on checking what's happening. Lots is happening. And lots can be done. Many times we ministers also feel that, you know, we are limited with funds, but that's not happening. It doesn't work like that. You need to actually find and channel what you want to do. You need to have a vision, take expert advice on exactly how you want to manage the state. And once you have that exposure, and then you deal and talk to several people, like I love talking to people, I love getting inputs also. And that helps me think in a little different way. Thinking out of the box. When Honorable Prime Minister had come to Goa, I shared with him a few things, and he was totally convinced, you know, that thinking out of the box is the way forward. Cribbing about something is not going to help any of us. Limitations will always be there. All of you from the management field also will find obstacles whenever you are working in any organization and all tomorrow, but you need to find and reroute yourself in trying to see how you can find your way forward and overcome that. Today, you should be very clear-cut exactly on what you want to do. It is very important when healthcare is something that deals with the people. Just now, somebody mentioned about infant mortality. We started work on infant mortality reduction on the IMR rate more than 10 years back. And it has been I have been fortunate that this is my third term as the Health Minister of the state of Goa. And at that point of time, we realized how much steps we had to take. We started newborn baby screening after Singapore. We took a company and we started. Goa was the first state in the country that was doing newborn baby screening to treat them for future metabolic disorders, which was nowhere. Nobody was talking about it. That's when we started it. There were certain immunization protocols which were only available in the private sector, which the government sector started. So whole idea, and also we have now tied up with Public Health Foundation of India. Dr. Srinath Reddy was there. With him we tied up, and that time, and now there's an umbrella of agreements which are pending. Some of them are still pending. Risky pregnancies in rural area, we are now starting call centers so that we are able to reach out to them. Proper appointments are given to them so they do not, and transportation of risky ladies who have a high level of risk as far as pregnancy is concerned, how to deal with them so that we are able to actually work. When we talk of IMR, every aspect of in order to maintain those figures is being done at the back end. I am very happy today that as a health minister, we are able to move forward, and with Goa Institute of Management also, we want to work, give the exposure to the students. And I'll share with you, you know, many times we think that building a big hospital is like, you know, some achievement, but it's running that hospital and operationalizing it to the fullest extent is such a challenge. Yesterday, I had a meeting with the medical officers in the evening, so I have kept a channel of communication. Unless a channel, you know, sometimes every minister feels that he can talk and he just directs and everything is done. No, it doesn't work like that anymore. You need to have an interactive session. So we keep a half-an-hour interactive session just to listen to what problems and functional problems they have and what are their suggestions. And moving forward, today Goa is the only state anywhere in the world MD medicine is required to thrombolize a patient. Today we have saved several lives. All of you know that the Goa STEMI program is one of the successful STEMI programs. Initially, people came to me. Some guys came and they said, this is our gadget. This is our thing. And through this method, it will go. I ultimately got fed up. And then I told our team of doctors, and luckily we tied up with a company called Trigog. And through them, we were able to commission. And today, Goa's STEMI program is being showcased by NITI Aayog to different parts of the country, that this is the manner in which you should move forward. Today, in any PHC or CHC you go, you are able to thrombolize a patient, and we are able to save the life of that patient. You see, we are spending crores of rupees on medications like Elexin and several other medications so that we are able to thrombolize him, stabilize him. what are the, basically arrhythmia was one of those. In those days, they used to say that the irregular heartbeat was another issue that comes through all this. So basically, you know, we put a team of doctors, our doctors monitor it, and, you know, we have a centralized dashboard which we have in the Goa Medical College, so there's any emergency to reach out to that doctor so that he's able to guide them. So I just feel that, you know, there's lots, and Madam is from Google Health. Sorry, I'm saying Madam, I don't know your name. I'll take your name later. But, you know, these are the institutions in which they think differently. They are in the new age. Like I said just now, told you about doctors. When you talk about cancer therapy, it comes immediately to your mind. It's only chemotherapy and radiotherapy, but today it is this hormone therapy is there. Then you have immunocell therapy. Then you have targeted hormonal therapy. Then you have combination medication that is put together. So there's lots happening in the field of medicine. And as a result of which, even if you're a policy maker, you need to think differently. Digitization, manpower, all that is fine. Artificial intelligence will come. But I have my doubts whether only with artificial intelligence coming, whether it is going to reduce the manpower requirement in the area of medicine. I don't think so. Because you require human interface at every given point of time. There are lots of articles that are coming, so many million people will be jobless and so many things will happen. But I really don't think, as far as medical science is concerned, there has to be utilization. Maybe you want to cross-check on what your diagnoses are, but I definitely feel the human interface will always be there, and human interface is a must, so that you are able to, you know, cross-check and be very clear exactly how you want to move forward. Lots is happening, even your inputs. I'm told that a lot of work is being done on the health sector by Goa Institute of Management. We would love to engage with the students on a separate day and find out exactly what your thought process is. But whenever you give a report, and whenever you give a thought, it should just not be just a report, you know, just what a report is, this is the thing, or you should also give a lot of solutions which are, you know, practically, which are possible for the state government to implement, so that we can implement and take your suggestions on board. I generally follow a policy is that what's in my head, I always place it on the floor of the house. Now, how many people read it, how many people have the bandwidth, I don't know. But I definitely do that, so that I always place that this is the vision of the government, this is the way we want to move forward. Now, when you talk to people in the medical field, people like Amit Maideo or somebody, some top professionals, they give a lot of input to you. And then you learn exactly how to move forward. There's Dr. Ashok Johari in Bombay, who basically treats children. If you look at his practice, many of you, when you're doing health, so you should go and actually interact with such people, you know, and see the reasons why our policy came into being. You know, giving Botox in those days used to be very difficult. It used to be, 36,000 used to be for a while. And people used to feel that it's a wonder drug. And that's it. Like one time I give that Botox, that's the end of it. I can move. I have interacted personally with patients. There was a reason for that. I interacted with them, sat, understood. You know, giving these on the intramuscular junction and all is another trauma for the family. But at that point of time, we included Botox even in our state Mediclaim for reimbursement, which many people have not done. We have given money, about 8 lakhs of rupees, from the age of 0 to 8, because there's a growing age. Basically, it's up to 11 years, where when you have a birth defect deformity or you have a skeletal issue, which are very costly, and this is only in the state of Goa where we give benefit to the people and we take care of the people in this particular way. Even bone marrow transplant, we have now started. We have got our own center now here, which we want to upgrade so that we can do liver transplant. Kidney transplant was started long time back. So there are new things which we want to take forward, and with inputs from Goa Institute of Management, and I'm sure what the conclave, whatever you all discuss, if there's anything practical. Like, you know, Goa Medical College at one point of time, we didn't have, you'll be shocked. This I'm talking about how many years now? I'm talking about 16 years back. 16 years back when I became a minister. So 16 years back, there were some outdated protocols that were being followed even when equipment was there. Then by default, I got in touch with somebody from Delhi. And he said in the Delhi Municipal Corporation office, those ARCs and all have been in, that you don't have to buy the equipment, only you have to buy the reagents. And that's when we started that platform. And today we have all the equipment that is required for testing in the Goa Medical College. We have every latest equipment in the district hospitals. And I have made it mandatory that as far as the sub-health centers are concerned, which will be commissioned, I think by 15th August or end of August, we are keeping semi-auto analyzers there, and we are training technical staff so that, basic things, the village person from the village doesn't even have to come to the PHC or CHC. So semi-auto analyzers there, then higher level equipment in the, as far as your PHC, CHCs are concerned, and other hospitals already equipped. We also have iStat machines everywhere. And iStat machine also where, through Wi-Fi we can immediately transfer the data wherever required to any doctor that you want. But that was required. I thought I should have that. It's difficult to maintain iStat machines at all across the sub-centers and all, because there's a temperature that has to be maintained. There are several issues which are there. But I wanted to just cross-check that troponin and other tests could be done there. So if somebody has a chest pain, he doesn't really think that it's not, whether it's a heart-related issue or it's something else. These things we have been doing. And there are several other things, I don't know whether I've covered most of the issues that Dr. Parulekar wanted me to cover, but this is the way one has to think out of the box and move forward. And very important for all of you dignitaries who are here, your input also is very important. But I would like to share with you that Goa is a very progressive state. We are constantly listening to people. We are constantly seeing what are the new things happening everywhere else, and we want to get those things within our system which is there and try to see that we move forward. And also the students, it's very important for you to go more into depth. Go more into depth and try to see what's actually happening. A policy, by framing a policy, nothing happens. What is the way you create those verticals and move further for implementation and evaluation? When a policy is created, many times I take these meetings, review meetings only for a reason that accountability is also there and I'm able to understand much better. I'm not a doctor by profession, but hearing, listening, talking to people and experts in the field constantly telling you what's new, what's happening. And it can happen to anybody, when you're in a position tomorrow at a managerial position or a advisor's position. I mean, you have to think that what suggestions you make should be that person sitting across who's asking you to make these suggestions, he should be in a position or also rooted in such a way that how he should reach that ultimate outcome. It's very important. I hear so many people across. Many times I spend 5 minutes, after 5 minutes I say this is not worth my listening, I'm not going to listen, but as a protocol I just sit quietly, listen to him. But there are some things then where people come with a thorough proper outcome and then you want to listen, Then you know that this guy is explaining something to you and this is workable. I work with a lot of consultancy firms. There are some people who were in ENY earlier who are now working with me personally in my Department of Urban Development. It's only because I want more knowledge. I need to enrich myself more for me to actually tweak the policy or do something differently. So exactly working with consultancy firms, working like Maharashtra, they had such a big docket prepared on health. And till today, not even one paper is implemented. Now why? I don't know. But I'm saying, when you make a policy or you're guiding a government, it should be such that the government is able to implement it in a very fast-track manner. I do not take much time. I want to wish you all, the students, all the best, and dignitaries also who have specially come here today, do share with us what your thought process is, and so that we can also pick up things from what your conclave concludes with. And I wish the conclave all the very best, and I would like to thank Dr. Parulekar for having me with him. I'm sorry I was a little late. I had some personal emergency which I think Dr. Parulekar can share with you later, because generally I'm always on time. He knows that I'm bang on time for every event, and I would like to wish this conclave success, and do share with us your inputs which will be very helpful for the state of Goa. Thank you.
Thank you, Honorable Minister. I'm sure we all resonate with you in this context. We are delighted to have the opportunity to present a video message from the Honorable Governor of Goa, Shri S. Sridharan Pillai, to the esteemed participants of this conclave. While our Honorable Governor graciously accepted our invitation, unavoidable prior commitments prevented his physical presence at the event. Nevertheless, we are privileged to have an inspirational message from the first citizen of Goa. Without any further delay, let us all proceed to view the esteemed video message from His Excellency.
Namaskar to all. I am extremely happy to participate in this program. 4th Annual Healthcare Management Conclave is an important meeting, I thought of coming directly for the program. I agreed for that also. But unfortunately, today, due to some urgent official meeting, I am not in a position to attend directly, and hence, through online, I am addressing you people. Integrating digital technology into healthcare system is an achievement of our country. This is a great moment in the history of healthcare in India. We all know that digital technology is widely spreading in every field of life. And technology, especially digital technology, connected to that innovative efforts and achievement to the nation is always we will be able to see. Development of wide range of digital health products such as electronic health records, telemedicine and health apps, etc. We can proudly say our country has gone to such an extent. We require more coordination and collaboration of more industries and academia to make India a strong country in healthcare system. Our union government, though through Ayushman Bharat Digital Health Mission, is promoting this endeavor. I am congratulating all of you for your best efforts connected to digital technology. I wish 4th Annual Healthcare Management Conclave a grand success. Thank you very much. Jai Hind.
Thank you, Excellency. Up next, unveiling the Healthcare Management Coffee Table Book. The Coffee Table Book provides an overview of the healthcare management department at Goa Institute of Management, including its inception and journey since 2013. It highlights the 10-year of glory of healthcare management program and key attributes on how it grew to be the best in the country. I invite Dr. Supriya Patnis, an assistant professor in healthcare management and chair of international exchange program at Goa Institute of Management. She has a doctoral degree in public health and doctor has worked over 15 years in the field of health, including esteemed organizations such as Incline Trust, Save the Children, Bill and Melinda Gates Foundation, to name a few. She has worked as State Program Manager for Government of Maharashtra, Directorate of Health Services. Dr. Patnis has been associated with Goa Institute of Manager since past 4 years and is a part of faculty team working on WHO funded projects. I request you to elaborate on HCM Coffee Table Book. Over to you, Professor.
A very warm welcome to 4th Annual Healthcare Management Conclave. So on this joyous occasion, it gives me an immense pleasure to present to you the Coffee Table Book that marks the 10-year journey of GIM's HCM program. As Professor Parulekar mentioned in his welcome address that GIM was one of the best first B schools in India to introduce a 2-year PGDM HCM program. Over the last 10 years, this program has transformed, taking into consideration the changing requirement of the industry, and has remained one of the best healthcare programs in country, a program that is industry-oriented and futuristic in its approach. This coffee table book is a humble effort to capture this exciting and transformative journey of healthcare management program. This book highlights some of the innovative strategies that GIM has been implementing and that marks this program a unique program in the country. Without a further ado, I now request all the dignitaries on dais to kindly unveil the coffee table book. Thank you.
Thank you, everyone. That was a momentous occasion indeed. On behalf of the entire team, I would like to extend our warmest gratitude for taking the time to speak out at this event. Your words are truly inspiring, and we are honored to have you as opportunity to hear you and such distinguished experts on the field. As a token of our appreciation, we would like to felicitate our honored guest. I request Professor Ajit Parulekar to felicitate our Honorable Minister, Vishwajit P. Rani. I request HCM Chair Professor Ajay Vamadevan to felicitate our guest of honor, Professor Sanjay Bihari. Thank you, everyone. Now let's split for a quick tea break, and I request everyone to be assembled by at best 12:15. Thank you, everyone.
We are GIM, Goa Institute of Management, spread across 50 acres of land
with 5 distinct programs.
We are inspired. Founded by Father Romuald D'Souza, one of India's most recognized contributors to the field of management studies, we echo ethical leadership through our thought leader interactions, pedagogy, and affiliations. We are diverse. Everyone is a minority at GIM. Our students come from all walks of life, from all across the country and beyond.
Assam,
Andaman Nicobar Islands,
West Bengal, Goa,
Haryana.
We are a community with over 3,000 influential alumni spread across 15 countries, distinguished faculty and global partner campuses. We are responsible. With our Give Goa initiative, our students work closely with NGOs to develop surrounding communities. We are responsive. GIM engages with business and industry and our society to ensure that our programs meet their needs. Our innovation lab, big data analytics, healthcare management programs and gamification learning are some of the things that ensure that we teach the right thing the right way. We are growing and raising the bar. Our placement committee helps students seize career opportunities that help achieve predetermined goals. We are fun. With varied on-campus activities, we provide holistic, non-classroom learning and community building. We are one with nature. Nestled on a picturesque hillock in Goa, our campus sets the perfect stage for easy and comprehensive development of our students. We are excited for our future and the leaders we make. That's why we are GIM, Goa Institute of Management, School of Next Marking Management Studies.
welcome to GIM. This 50 acres landscape is the home ground of sustainability. Here we create responsible managers for tomorrow because sustainability runs in the DNA of GIM. So we can proudly say grass is always greener on our side. But how have we achieved this? Solar plant is a major energy source at GIM. Energy consumption is monitored and audited. LED lighting saves energy. The pool transport system reduced both oil consumption and CO2 emissions. GIM boasts a rainwater harvesting pond, an atmospheric water generator, and 2 sewage treatment plants. Bean-wise segregation scheme treats dry and wet waste. The plant species in the campus are documented and published as Floral Biodiversity Register and Coffee Table Book. The faunal diversity within the campus project is in progress. GIM CESD has completed projects funded by Finnish National Agency and German Development Institute. GIM CESD is a part of Sustainability Centers community with 150 other global sustainability centers. The Give Goa initiative upholds sustainability among local communities to student projects. 87 projects have been completed in the last 5 years. Sustainability Hackathon is conducted every year to encourage and reward innovative ideas to develop sustainable campuses. The No More Use and Throw campaign by GIM students has already saved 96,000 paper cups. GIM has contributed towards the Green Industries Goa campaign. Sustainability Horizon disseminates the knowledge and practices of sustainability. All our support staffs come from local communities with almost 50% rural women.
This is how.
The grass is always greener on our side.
This is how.
Our responsible managers make it green. On the other side as well.
This is how.
We will be a net zero campus in the near future.
Give Goa is a unique program, and through this program, students are oriented towards the social sensitivity. Students go out in the community and work with underprivileged section of the society. Development of empathy and humility is done through this Give Goa projects.
Give Goa gives the students of GIM to work on a range of projects which can be in the field of agriculture, in rainwater harvesting, financial inclusion. A lot of health projects students take up as part of their Give Goa course. Basically what Give Goa does is to sensitize students about the grand challenges that the society has. It also helps students to enhance a lot of their skill sets and also teaches them to build new skill sets. Now these skill sets could be communication, teamwork, strategy. Give Goa helps them to innovate, to understand how do they strategize when they are faced with challenges. As they learn in the classroom, they have the opportunity to go out and directly experiment what works when faced with a real life problem. They undergo a sensing journey. They interact with various stakeholders, understand their pain points, and then strategize. Give Goa adopts a design thinking approach, and I think it is a fantastic way of teaching the students how to be responsible leaders in the industry which they would join after the 2-year course.
The Healthcare Management Program at the Goa Institute of Management was started in the year 2013. Over these last 8 years, we've been able to benefit over 500 students. A lot of these students today are employed in some of the best organizations in the country, and many of them now work in various parts of the world. This program has helped shape and benefit the overall healthcare industry in the country. Today we have a large number of our faculty and our students who influence in a small way health policy.
It's a niche and holistic program by design. We impart cutting-edge knowledge and skills in 6 different verticals of healthcare management. This allows our students to be at the top of all aspects of healthcare management, including marketing, sales and distribution, operations, finance, and most importantly, ethical and responsible leadership.
Digitalization is going to be the norm of healthcare. The COVID pandemic has only accelerated the pace of digital transformation. Technology innovations led by big tech companies and startups are driving the adoption of technology not just for the provision of healthcare, but also for B2B transaction between hospitals, big pharmas, laboratories and medical equipment companies, changing the landscape of healthcare sector.
Designing meaningful innovations is a key to success in healthcare. Healthcare sector is the biggest one to witness startup growth, not only in India, but across the world. The future managers need to learn the art of innovation. And we are proud that our curriculum imparts the knowledge on all facets of innovation and encourages the students to innovate with a strong purpose.
Our collaborative research work with and for national and international organizations of repute gives us the opportunity to contribute in some way to building more equitable and efficient health systems and to public health policy. We then bring these learnings into the classroom where we can discuss them and engage with our students.
We believe in experiential learning, hence we take our students to hospitals, pharmaceutical plants, where students work on live projects where they implement all that they learn in class.
The curriculum of HCM program is designed in such a way that it helps students, the future healthcare professionals, to equip themselves not only with core competencies but also soft skills which are essential while dealing with diverse clients from the field. We give practical exposures to students through different innovative technologies of teaching. We do book reviews, we do film reviews, we do panel discussions from various experts from the field so that the students are aware about the current developments of the field nationally and internationally.
One of the mission objectives of the Goa Institute of Management is to create socially sensitive and responsible managers. To this end, we offer a unique service learning program known as the Give Goa Health. The Give Goa Health enables students to work with an NGO for a year and help them solve a range of their managerial problems. Give Goa Health is very special because it makes the students socially sensitive, allows the students to interact with the client, the community, understand their needs and come up with effective and very creative solutions.
We encourage students' mobility across the borders through our international exchange programs. We are in collaboration with some universities in Europe, Southeast Asia and North America and even in Sub-Saharan African countries. So the students will get an opportunity to spend one term in the collaborating universities and they will get the exposure from the experts from that particular universities.
To ensure that students actually learn to manage this VUCA world, most of our courses essentially gets incorporated with simulations, putting them into real life scenarios in which the simulations themselves are tweaked so as to bring about that volatility. Case studies is another interesting pedagogy which I use to ensure the students are able to take decisions in this complex and ambiguous environment. Each of these pedagogies are used specifically in the courses of new product development, marketing management, sales and distribution, and therefore really trying to bring out the best of students and build those leadership skills which our VUCA world really aspires them to have.
As the world is shrinking and the managers are becoming more global, we provide in-depth knowledge of healthcare systems,
in the leading countries of the world. We also invite thought leaders and experts which interact with our students so that they can learn from the achievers themselves.
This is not Wall Street. This is the finance lab at the Goa Institute of Management, or as we call it, GIM. But there's more to GIM to dive into. This is the gym, where students do half of the heavy lifting, not the kind of B school is known for. And this is Jaggu, who students visit to take the load off. He has refreshments, munchies from his well-stocked daily needs store, and a whole lot of chuckles. This is the library for the silence and food for thought. It's open 24/7. And for some food for the belly, this is the mess. It's the opposite of messy. And as much as the food is balanced by a team of 3 master chefs curating Indian and continental cuisines, it'll take you back to your mom's kitchen. And this is where your mom will expect you to spend most of your time. And professors too. Lumbar support? Check. Surround PR system? Check. Disconnect from the outside world? Not so much. This is Aravalam Waterfall, a few minutes away from campus. Connection with nature? Check. This is the special tree. It's just peaceful to be around it. And right around it, here's the prayer room. For those midweek blessings. Or the ones you might need before placements. But would you? This is Sujaya Rajkhoa, all set for her placement interview. She's not nervous at all. 100% placement record? Check. This is the multi-purpose hall. It can house 4 fighter jets, as much as it can host convocations, badminton tournaments, and thought leadership sessions, like the peace session we held with the Dalai Lama. Speaking of peace, this is the view that students wake up to. This is the sky at sunset. And this is the sky at midnight. But there are no bedtimes at GIM. In fact, midnight is when the life of the campus begins to spark. These are a few fun events hosted by many of the student-driven clubs. Clubs that complete the campus life. And for whatever's left incomplete, this is the maintenance team who will help you fix a tap leak and climate change by installing solar power systems. With over 75 professors, 50-acre campus and 6 programs, this is GIM, the B School gem in Goa.
We are GIM, Goa Institute of Management, spread across 50 acres of land
with 5 distinct programs.
We are Inspired, founded by Father Romuald D'Souza, one of India's most recognized contributors to the field of management studies. We echo ethical leadership through our thought leader interactions, pedagogy, and affiliations. We are diverse. Everyone is a minority at GIM. Our students come from all walks of life, from all across the country and beyond.
Assam, Andaman Nicobar Islands, West Bengal, Goa, Haryana.
We are a community with over 3,000 influential alumni spread across 15 countries, distinguished faculty and global partner campuses. We are responsible. With our Give Goa initiative, our students work closely with NGOs to develop surrounding communities. We are responsive. GIM engages with business and industry and our society to ensure that our programs meet their needs. Our innovation lab, big data analytics, healthcare management programs and gamification learning are some of the things that ensure that we teach the right thing the right way. We are growing and raising the bar. Our placement committee helps students seize career opportunities that help achieve predetermined goals. We are fun. With varied on-campus activities, we provide holistic, non-classroom learning and community building. We are one with nature. Nestled on a picturesque hillock in Goa, our campus sets the perfect stage for easy and comprehensive development of our students. We are excited for our future and the leaders we make. That's why we are GIM, Goa Institute of Management, School of Next Marking Management Studies.
Welcome to GIM. This 50 acres landscape is the home ground of sustainability. Here we create responsible managers for tomorrow because sustainability runs in the DNA of GIM. So we can proudly say grass is always greener on our side. But how have we achieved this? Solar plant is a major energy source at GIM. Energy consumption is monitored and audited. LED lighting saves energy. The pool transport system reduced both oil consumption and CO2 emissions. GIM hosts a rainwater harvesting pond, an atmospheric water generator, and 2 sewage treatment plants. Bin-wise segregation scheme treats dry and wet waste. The plant species in the campus are documented and published as Floral Biodiversity Register and Coffee Table Book. The faunal diversity within the campus project is in progress. GIM CSD has completed projects funded by Finnish National Agency and German Development Institute. GIM CSD is a part of Sustainability Centers community with 150 other global sustainability centers. The Give Goa initiative upholds sustainability among local communities to student projects. 87 projects have been completed in the 5 years. Sustainability Hackathon is conducted every year to encourage and reward innovative ideas to develop sustainable campuses. The No More Use and Throw campaign by GIM students has already saved 96,000 paper cups. GIM has contributed towards the Green Industries Goa campaign. Sustainability Horizon disseminates the knowledge and practices of sustainability. All our support staffs come from local communities with almost 50% rural women.
This is how.
The grass is always greener on our side.
This is how.
Our responsible managers make it green. On the other side as well.
This is how.
We will be a net zero campus in the near future.
a snapshot of healthcare research at GIM. I call upon Professor Arif Raza, Associate Professor at GIM, to deliver this. Professor Raza has been an esteemed member of HCM program at GIM for the past 9 years. Prior to joining the institute, he gained valuable experience in hospital industry. At GIM, Professor Raza has not only excelled in role of educator but also has taken numerous leadership responsibilities, including serving as placement chair and program chair. Presently, he holds the esteemed position of Chair of Assurance of Learning at an institutional level. Additionally, Professor Raza actively engages in conducting sponsor research projects and esteemed organizations such as National Health Authority and World Health Organization. Through his invaluable contributions, he is making significant strides towards advancements in healthcare in the country. Over to you, Professor.
Thank you very much, Harshvardhan, and welcome back to the conference, to the conclave. It's my pleasure to present the kind of work that we do here in Goa Institute of Management. The healthcare management team in our department is a small team, about 11 faculty members, including our director. Director also is a part of our healthcare management department. So on behalf of my entire team, it is my pleasure to present whatever we have been able to do and what we aspire to do. So as you all know, we started 10 years back, and after initial few years of churning, we got stabilized and we have about 11 full-time faculty members in the department. These are my faculty colleagues. We all come with diverse backgrounds, somebody from med device industry, someone from hospitals, from public health, along with the functional knowledge of management, somebody from marketing, operations, organizational strategy, and so on. Together, we all are binded by a common theme, which is healthcare. We've been lucky enough that the team is very strong, relatively young, but very committed team, aspiring to make some sort of a positive contribution in improving the healthcare of our country and healthcare of our people. So we very actively engage with each other. We collaborate to complement the expertise that we all held together. And as a team and also as an individually, we have taken up several projects. Last 5 years has been a lot of progress in the kind of work we have been able to do and demonstrate to the government and to the corporate as to what kind of solutions that we could generate. So what I'm going to do is to pick up few of the studies that we have taken in recent years and give you an overview of the work. So the idea is just to share the scope of work and the kind of work that we do and what do we further aspire to do. We all know making payment to the worker at a field level is challenging. It is difficult. Oftentimes there are missed payment, wrong payment, or delay in payment. Those kind of inefficiency happens. Such inefficiencies are also there in healthcare when it comes to the health workers, right? So in this context, Professor Kea Furtado has undertaken a work on digital financial payment to health workers in India. Basically, she studied on how the payment system is organized and how the digital payment systems are being adopted and what could be done to streamline the inefficiencies in the payment that is being done. She has collaborated with Professor Richard, Professor Margaret, and Professor Sebastian from Harvard University. It was a 2-year-long project which just got over. And the entire project was funded by Howard T.H. Chan School of Public Health, which was a sub-award of Bill and Melinda Gates Foundation. Universal health coverage for India. Every country, every state is aspiring for that. The question is how, and there are a lot of work which is already done, but the topic is so big that it requires a lot more contribution and a lot more thoughts by the thought leaders. In this context, Dr. Kea Furtado again has been taken as a commission fellow by a Lancet commission which has been set up to reimagine the India's health system. The commission is being chaired jointly by Professor Tarun from Harvard Business School, from Professor Vikram Patel from Harvard Medical School, Kiran Mazumdar Shaw from Biocon, and Professor Gagandeep Kang from CMC. The aim of this particular commission is to lay out a roadmap for achieving universal health coverage in India. We do hope that the commission comes up with some practical, futuristic kind of a roadmap for our country. We all know the role that primary healthcare play in making the healthcare system better. For the country like ours, which got more than 1 billion population, how do we ensure that healthcare reaches all? It cannot happen if the primary healthcare is not organized in an effective and efficient manner. There are a lot of scope of improving efficiency, and in that particular area, some contribution which has been done by our program chair, Professor Ajay Vamadevan. He has undertaken a long study, in-depth study on a project on digital health-enabled intervention to tackle multi-morbidity pattern in primary care in India. For this study, he collaborated with Medical Research Council UK and Center for Chronic Disease Control, New Delhi. The duration of the study was 2.5 years, which has just got completed. The entire study was funded by Medical Research Council. One of the very big challenge and often a complex challenge in healthcare is how do we ensure the quality when it comes to delivering healthcare to the masses. So in that context, myself along with my colleagues Supriya and Nafisa, we undertook a study on mainstreaming care quality at Ayushman Bharat PMJ Impaneled Hospital. As we all know, Ayushman Bharat is now funding the treatment of roughly about 50 crores Indians. So that is going to be one of the big financier for the treatment that our people are having. How do we ensure that these people receive care while the access has been created, they actually get good quality care? So the aim of this particular project was to develop a policy design and strategies at a national level to how to enhance the quality of care being offered to these beneficiaries. The recommendation from this study has gone to National Health Authority of India. Duration was about 12 months, and this study was completely funded by World Health Organization. Continuing on with the quality theme, the second study that we undertook immediately after completion of this was on adoption and effect of standard treatment guidelines under PMJ. We realized that for quality to happen, it is also important that clinical protocols and clinical systems need to be put into place. So while the SDGs was already framed and into place, what we did is that did a study to understand what kind of an effect it is creating on field amongst the doctors, among the third-party payers, amongst the patients, and so on. The aim was to evaluate the early experiences that the stakeholders had with the SDGs. Again, the recommendation gone to the National Health Authority of India for incorporating the suggestion in their policy design or future policy modification. It was a 6-month-long study, again funded by World Health Organization. We're happy to say that at this point of time, we also extended our project and we involved 2 of our second-year students in this particular study who helped us and also in return learned something about healthcare. Access is extremely important. We all talk about healthcare access. What kind of networks are required? What are the gaps that are available when it comes to delivering healthcare to so many people? So in this context, Dr. Sean Coutinho has undertaken Sandhan, which is scouting and nurturing development of healthcare access networks. The aim of this particular study was to lay a foundation for potential investment within the social impact space to foster development of networks supporting healthcare access. So a lot of outcomes that, a lot of result that his study brought out, some of them are displayed here, identifying demand, supply, and the kind of a quality gap that exists within healthcare and kind of impact assessment model that would work, and also give a framework of how this, investments could be made to improve the access networks. It was a short study of 2 months, was sponsored by IKP. Here also, 2 other students were incorporated to help with this study. How do we make our youth resilient in dealing with the future uncertainties, right? Our youth is actually going to take up a lot of leadership thing. In that context, government has already been running a scheme called as a PMKVY, Pradhan Mantri Kaushal Vikas Yojana 2.0. Our team, led by Dr. Prakash and Dr. Shirupa and Dr. Joy, they took up this study on skilling youth of Goa and assessment of the short-term training under PMKVY. The objective was basically to explore and to suggest to the government that how can we make this training program better? How can this training program actually be more effective and develop our youth to tackle all the future uncertainties that they might face? We all talk about disruption, so if the disruption is happening, the youth need to be prepared for that. The duration is 1.5 years, which is under process, it is undergoing. It's being funded by Azim Premji University. When Ayushman Bharat was launched, and we considered that as a very big event for India, because that at one go, so much of access has been created, access has been created for so many people. So in initial days, there was a concern on how do we implement such a large program. So there were two models that were being discussed. So when the PMJ got launched, we were fortunate enough to get to participate with Ayushman Bharat right from the beginning, to understand that what has been the implementation experience at a very early stage, so that we could make modification for the future years on implementation of PMJ. So on that context, Dr. Khea, myself, Dr. Devashish, and Dr. Nafisa, we took up this study on assessment of early implementation experience of trust and insurance model of the PMJ. This was basically to see the early experiences, see what inefficiencies are being created, what is good, what is bad, and then recommend it to the NHA. Again, the recommendation went to the NHA. It was a 7-month long study. We completed it back, when PMJ was just 6-month-long project, again funded by World Health Organization. One of the big issues when we talk about universal health coverage is that we have a lot of fragmentation in the way healthcare is being funded by the government. So there are multiple schemes in each state. A lot of schemes, they overlap in the terms of beneficiary they are covering or the diseases they are covering. So if they all could be integrated and made one big scheme, a lot of these inefficiencies or overlaps could be avoided. So the question is how? So on that context, the first study that we did was related to the Assam. Assam had 5 or 6 different schemes, small, large scheme all put together. So we were requested by Assam government, again channeled through World Health Organization, to study and suggest them as to how we can actually, how they can, in a short term and a long term, can first harmonize and then ultimately integrate their multiple health financing scheme and bring in more efficiency and more result with the limited resources that the state has. The recommendation has gone to the state of Assam, and I'm happy to share that most of our recommendation has already been implemented, and same is true with the previous study that we have done. It was a 6-month study funded by the World Health Organization. Based on this particular study, the result was good, and this was appreciated by the state. So we were then given a bigger task of developing a model, of developing a framework of how do other states who are facing with a similar kind of a challenge, similar problem, how could they take up this task, this challenging task of integrating so many different schemes that they are learning, that they are running. So this study was again undertaken by Dr. Khea and myself on framework for integration of health financing scheme. The aim was to develop a guide for middle and low and middle income countries on if they want to integrate, and every country is trying to integrate their health financing system. How can they go about that, and what are the steps to that? This is to be published by WHO and is going to serve as a guide for the entire lower and middle income countries. 6-month long project, we just finished it, again funded by World Health Organization. So these were just an idea about the recent work that we have done in the space of healthcare. You'll see that it has to do with the health system, the quality improvement, the digital part, the management part in terms of identifying demand supply gap. That's all been possible because we have a diverse group of faculty team who kind of help each other, who coordinate and engage with each other and try to take up projects on team to cover the entire and make the study comprehensive. We know it's a very small contribution, drop in ocean compared to the amount of work that is required for the development of the healthcare. We do aspire to undertake similar and more challenging tasks and do whatever we could do as a team to contribute from our side. In last 5 years, we've been able to publish. So most of these studies, we ultimately try and publish it in a reputed journal so that it becomes available to the global audience for them to refer to. 70 published paper in last 5 years by all of us. 12 sponsored research studies worth about 5 crore rupees. And we would like to increase that, and we'd like to do more on that. That's it from my side. Thank you very much.
Thank you, Professor. That was indeed insightful. The healthcare industry is pivoted to transformation in healthcare. The healthcare provides implementing digital technologies to improve patient care and outcomes. The pharmaceutical companies use digital technologies to develop new drugs, conduct clinical trials, and manage supply chain. Health IT companies are developing and providing software, hardware, and services to support digital transformation. Insurance companies are using digital technologies to improve customer experience, carry out risk assessment, and fraud detection. Many startups are emerging in digital health with innovation solutions to address various healthcare challenges. The ecosystem of digital healthcare system is made up of diverse stakeholders, each with a unique role to play in the development and implementation of digital health solution. The senior leaders from healthcare industries will now deliberate on this topic. The panel 1, Role of Industry in Digital Metamorphosis of Healthcare, will be prevailing now. I call upon Dr. Supriya Fatnis to introduce the panel 1, and I request all the delegates of panel 1 to kindly felicitate the stage. Thank you.
A very warm welcome to all the panel members of panel 1. It is my privilege to introduce to you a distinguished professional with over 2 decades of experience cutting across the healthcare industry and financial services, Mr. Kshitij Kumar. Throughout his leadership journey, he has worked extensively across Indian subcontinent, Singapore, Turkey, crossing multiple geographies and cultures. He has been credited with creating several new business models across geographies. With his expertise in putting business on rapid growth trajectory and turning around underperforming businesses, he has made a significant impact in the industry. Mr. Kumar was the founder director of Health Map Diagnostics Private Limited, a unique healthcare venture of Manipal Group and Philips. This was for scaling up the diagnostics in public hospitals in India through private-public partnership. He has also worked at Johnson & Johnson and GE Capital. He holds a BTech degree from IIT Dhanbad, MBA from IIM Kolkata, and Advanced Management Program from INSEAD France. He is also Institute of Director Certified Independent Director and Certified Six Sigma Green Belt. Mr. Kumar is currently a co-chair at FICCI Medical Devices Committee and is also a member of Governing Council at Nat Health. Thank you, and please join us on the dais. I would request all the panel members if we could, have you on the dais. Thank you. Our next panel member is Ms. Jayashree Kulkarni. Ms. Kulkarni is a strong business leader with over 24 years of diverse and multi-segment experience in healthcare across India and Asia-Pacific region. Her expertise span across pharmaceuticals, healthcare consulting, and medical devices, where she has played various roles ranging from sales, corporate strategy, consulting, business development, insights and analytics, and most recently, commercial and business leadership. Ms. Kulkarni brings solid hands-on experience, learning experience, and success in the commercialization of new innovative business ventures. Her extensive background includes navigating the complexities of healthcare delivery, developing effective go-to-market models, and successfully launching groundbreaking products and services. Ms. Kulkarni completed her MBA from SP Jain Institute of Management and Research from Mumbai and holds a bachelor's degree in pharmaceutical sciences from ICT Mumbai. Her accomplishments in her field have made her one of the most respected business leaders in the industry, and we are honored to have you here as one of our panel members. Thank you for joining us. Our next panel member is Mr. Lalit Misri, a partner and co-head of healthcare sector at KPMG in India, and a renowned leader in the healthcare industry. With over 21 years of experience in the sector, Mr. Lalit has worked across public and private sectors and in 5 countries. He is an expert and executive a large national and state level projects in digital health, process transformation, hospital re-engineering, health analytics, care system redesign, PMP, quality accreditation, and operations excellence. Mr. Misri has extensive experience of working with medical device companies, health insurance providers, and setting up hospitals and medical colleges across the multiple locations. He has authored more than 10 healthcare sector research and policy reports for KPMG and many articles addressing key healthcare areas. Mr. Misri is currently a part of KPMG Global COE for universal healthcare coverage and drives the universal health coverage agenda in India. Thank you for joining us today. I'm pleased to introduce Dr. Om Manchanda, a distinguished business leader with over 33 years of experience. Dr. Manchanda started his career in 1990s with Hindustan Unilever and worked there in various positions for nearly a decade. He then moved to Monsanto India Limited as their national marketing manager and later as their national sales manager. In 2003, he joined Ranbaxy Laboratory Limited in their global consumer healthcare division before joining Dr. Lal Pathlabs in 2005. Over the last 18 years, Dr. Manchanda has successfully transformed LPL from a small business to a professionally run listed company. He holds an MBA from IIM Ahmedabad and a graduate degree in veterinary sciences from HAU Hisar, Haryana, and has completed advanced management program from Harvard Business School. Dr. Manchanda has received several prestigious awards, including the EY Entrepreneur of the Year Award in 2019 in Healthcare and Life Sciences category, and the Healthcare Personality of the Year 2020 Award in the FICCI Healthcare Excellence Award. Thank you, Dr. Manchanda, for kindly accepting our invitation and be a part of the panel. As a panel member, last but not least, our very own faculty member, Professor Sean Coutinho. Professor Sean is an associate professor in healthcare management program and currently the placement chair of 3 programs, healthcare management, big data analytics, and BIFS. He is an established academician and subject matter expert in the domain of healthcare and marketing. With more than 10+ years industry experience in brand product management and sales for leading organizations like Johnson & Johnson's, CONMED, Wipro, Reliance Energy. He has more than 6+ years of experience in academics and is a distinguished researcher with publications in international journals. He constantly works with different healthcare organizations to understand former precedents of Philips Healthcare and consumer lifestyle in India and South Asia. He has also served as a chairman in various committees, including CII's Medical Equipment Division, FICCI's Medical Equipment Forum, and FICCI's Healthcare Services Committee. Currently, Mr. Bose is engaged in chief advisory mentoring roles in renowned organizations like FICCI Healthcare, Tata Medical and Diagnostics, Experience Flow Silicon Valley Global Co., Praxis Global Alliance, and India Accelerator for Startups, and yes, our very own Goa Institute of Management. He is a frequent panelist, moderator, and participant in various industry events, webinars, and engagement in both private and public sectors. It is truly our pleasure to have Mr. Anjan Bose, a true visionary in the healthcare industry, as our moderator for this panel discussion. Thank you, sir, and I request you to take over. Thank you.
Okay. So, first thing of taking over, I have to ask Professor Ajay, the boss of this whole day's program. It's 1 o'clock now, and 1:40 p.m. as per the agenda is the lunch. So is it 40 minutes or as per schedule 90 minutes? Because everything will emanate from there. People, they will all say, no, 1:40 lunch. Something in between. I think that's typical Om. That's why Lal Pathlab is doing so well. The balancing factor. So can we fix a time, Ajay? I mean, guys, by the way, you know, my moderation is conversation. Okay, we'll have some fun. Is 60 minutes okay? Now, you all need to recognize that's a disruption for me. I'm so well prepared with timing and everything written. So we are starting with a disruptive innovation, which is the order of the day in digital health. So guys, either I have to cut down on the questions, which I'm not going to do, or you have to speak fast. Whatever it is, I can tell you one thing, the beloved students here, I've enjoyed working with you, teaching some of you maybe, is that this panel is very special. Between them, they have immense experience in diverse fields, and I myself am here to learn from them. So just quick start, a few. Sometimes we deviate from theme of a conference. So I'm just wanting to remind ourselves. Some buzzwords here that I'll ask all the panelists, my fellow panelists, to remember. We are talking about digital health. We are talking about sitting in gym, industry, academia, collaboration. So whatever we say, keep this in mind. And of course, keep in mind, gym is the best. Okay? So now make it happen. You know, gym is the best. Absolutely. You know? Yeah, I know you will agree. So do I, you know, for the last 4 or 5 years at least, 5, 6 years. And then, so that's important. And then it's a personal mantra that I say everywhere. It takes 20 seconds. I'll quote Einstein also. So before that, I'm quoting myself. C square I is my simple success mantra in healthcare. CCI. Any taker, let's make it interactive. What is this CCI? Come on, be bold. C for just one word. C for collaboration, C for commitment, and I for innovation. To me, digital health or much of healthcare that has developed in the last 10 years, 15 years can be covered. You know, you need to have committed leaders like this here to make their organization and healthcare industry a success. You need collaboration is 1 + 1, we keep hearing 3, it is 30. I have personally felt while founding with great difficulty Nat Health 10 years back. Actually, collaboration is the name of the game, and you saw success stories which, where is my friend Arif, under whose leadership actually at that time, Ajit, when you brought me, I'm grateful to both of you for giving this opportunity in GYM and HCM to be with the students and great faculty. So C square I, everything that we discuss has to have an aim, and the path possibly is CCI. We have to collaborate in today's world. We can't do anything alone. We have to be ready for that. We have to have the expertise to do that. C for commitment. And healthcare is a demanding field. It's a marathon race. It is not e-commerce, short, quick, and then something happens. I almost at my tip of the tongue, there is there's an education company's name that comes, which is creating a lot of doubt after raising a lot of fund. So health is not that. Health is a marathon. You have to have resilience, and hence a lot of commitment and innovation. Digital health itself is an innovation. So, you know, everything that we discuss has to have the objective of serving the citizens of this country and doing some business. There is no shame in that, healthy business. So, again, I repeat this, that we all say, healthcare needs to be made available, accessible, affordable, quality, and innovative. Now, if you think for a moment, these 5 words, they are not in tandem. Often they are at cross purposes. So I think the capability of the leaders here is that they have mastered the art of balancing this, and yet, you know, run a company which is profitable, which is growing, and also serving the citizens of the country. So basically, having said this, the structure will be a couple of minutes of initial comments by each of you, and then there will be 8 subheadings focused towards digital health, where I think a couple of my friends here and fellow panelists, I'll be directing these thoughts, and they'll share the thoughts. And Sean, as I promised, there'll be maximum number for you. Okay, so let's start. Let me start with the lady in the panel. So your initial comment on this whole subject. I think we heard a lot of good things in the last couple of hours, 3 hours in the morning. So please go ahead, Jayashree. Your opening remarks.
Thank you, Anjandar. Can you hear me? Now, can you hear me?
Yes.
Okay. Good afternoon, all, and I think it's a privilege for me to be here. I love this topic, and I think when we started talking about it, I said it's great to come into a forum which has experience on the panel, which has young talent sitting in the audience, and an institute that is really thinking from a future perspective to come and share and then probably also learn. So that's my motivation to be here. As somebody who has just recently taken over the country leadership for pharmaceuticals for J&J, I think digital has been on my mind as the #1 priority. And the reason why I say this is, as was put up earlier, with COVID, I think our understanding and our appreciation of the power of digital has really changed. And it's changed across multiple aspects. And if I take pharmaceuticals as an example, I think across the value chain you see acceleration at a very, very fast pace. So 3 years back when we were having conversations on what does this digital mean for pharmaceuticals, I think it was limited to saying, can we do discovery smart? Can we look at pathways in a better manner using the power of data? Can we look at simplifying our supply chain, which is increasingly becoming complex with the power of digital? And then can we start looking at engaging with our practitioners, our surgeons, our physicians in a better way? With COVID, that really changed, and I'm glad it did in a manner that it really made us sit and think very, very differently and say what's the power of digital and data science and technology that can really change this. So for me, I think two things that I would want to mention is one, how an external event or pandemic, unfortunately or fortunately, has really triggered different thinking. And second, it's expanded for us how we look at technology in all aspects. What's also a positive for me as I look at this role is that externally, I think the government, the academia are also looking at technology and digital in a much more ambitious and aspirational mindset. And if I compare that to other markets and the way we've managed that in COVID as well, we see that there is potential, and we see that there is potential for us to leapfrog. So those 2 or 3 things really make me feel very, very positive and optimistic and willing to look a little bit differently on what Anjanda said, which is how do we collaborate? Because individually, each of us may be very good at our core, but together with experts across multiple value chain segments, how do we bring that together and really transform it?
Thank you very much, Jayashree. That was a very crisp and opening remarks with good substance. I'll quote Einstein here, 2 of them, before I give it to Om. You next. So a very simple quote from Einstein. One is, yesterday I was going through and I found this and I felt relevant to you students and to all of us. One is, someone who never, I couldn't believe that Einstein would make such a simple comment, so powerful message. Someone who never made a mistake, never tried anything new. Yeah. To me, it's a very powerful message, I think the leaders and the leaders here, the leaders in GYM are all here because they were bold enough not to flinch away from making mistakes. They took risks. And I think that's an important thing when we are discussing digital health, because we don't even know the risks. Before Om takes a decision, Dr. Manchanda takes a decision for country's largest and most successful diagnostic company, and Asia is one of the best, and I'm proud of that, that if you put yourself in his shoes, I mean, how does he decide how to balance the risk? But he has taken risk, and he has not flinched away from looking at different things, knowing that there could be some mistakes, and that's, I think, the hallmark of super leaders, good leaders, which you all will be in future, I have no doubt. So that's one that sort of impressed me. And the other one is, I think for all of us, that if you can't explain it simply, then you don't understand it. It is very, very interesting that, there is so much of communication going on today, and often I hear, even in an academic institution, after so many decades of being in healthcare and management, I am sometimes confused. And I'm thinking that, should I be confused? Am I losing my brains, or it can be communicated in a simple way? So these 2 simple Einstein quotes I felt are very relevant today. And Om, may I request you to please give your opening remarks.
Thank you, Anjan, and good afternoon, everyone. I guess on this topic, we'll have few questions later, and probably I'll touch upon this subject during that process. But my opening comments, I'm just thinking myself, if I'm sitting like one of you in this room, 35 years back when I was graduating from in the institute, what would be going in my mind? And I presume all of you are, since healthcare focus, and you're sitting in front of these industry leaders, I guess you're looking for some guidance, some career advice, which can come handy. So in my entire experience, I have realized that the big picture is that there's a problem and then we are finding a solution. In healthcare conferences you go, you hear these three buzzwords, like healthcare has to be accessible, has to be affordable, right? And has to be available, I guess available and accessible are the same thing, and has to be quality, right? And in my entire 18 years in this space, I have come to realize that I think on clinical side, our country is fairly well sort of managed. And I think where we are probably falling short is on the management side. I often say, I know I'm saying again this, if management skills were not required, I wouldn't be sitting in this company and doing this, because I was working with Hindustan Unilever, etc. There are many such examples you see in hospitals, etc. I think the kind of institutions that are successful, they are successful because of great management skills combined with the clinical skills. I think people sitting in front of me, all you guys are the future of this country, and you have a great career ahead. Digital is technically, if you ask me, is one of the tools to build that, to solve these problems of accessibility and affordability. In my experience, I think healthcare organizations have to leverage scale. And we are at a very unique position with 1.4 billion people. If you build scale, the entire cycle gets into a virtuous mode. Because scale brings in a lot of economies of scale, and then that you can plow back into pricing, make it affordable, and if it's viable, automatically it will reach. Like you look at telecom, right? It virtually reached every nook and corner, not because the need always existed. Healthcare is also like that. Need exists. Everybody needs healthcare. I don't think you need to worry about demand. You need to worry about more about how do you service the demand. And I think the digital, to my mind, is a new emerging disruptive tool which can make organizations to differentiate and be competitive and also provide the service at an affordable prices. I think you have a great career ahead. Just focus on this, because you are actually going to be the champion of change which this country requires. And you are going to be working for some of these large organizations, institutions, which actually will bring this change. Whether they are new age or old one, I think to me it's a mindset issue. I know often our company gets branded as a legacy company. But to my mind, if I look at internally last 6 years, we are as tech as anybody else. The amount of effort that has gone inside, and I know that. And I'll share as to what are those things we need to do. In my mind, I think if my company suffers from something, it's people like you who can bring that change. So you have a great career ahead. Thank you.
Excellent. Thank you, Om. Champions of change. I think one of the phrases of the day, for me at least, is that. So that's a great responsibility Dr. Om Manchanda has given to all of you. And I think it's a good responsibility. So Lalit, can I ask you to give your opening comments? You know, KPMG, nobody needs to know what KPMG is. And as healthcare head, I think Lalit will have one of the best overviews of healthcare, 360 forest view, and not only individual tree view. So your opening remarks, please, Lalit.
Thank you, Anjanda, and thank you, Goa Institute of Management, for having me here. In a digital health, I think we are in a very right moment in the country right now. For any new technology or a trend to pick up, the most important thing is availability of a conducive environment, policy, and larger acceptance and awareness among the consumers to adopt anything. I think in the post-COVID, the awareness about the digital health, the acceptance and overall adoption has significantly gone higher. We would believe that the patient can be treated from home, which was not possible. Telemedicine has been there for last 2.5 decades actually. But the patient's confidence in the technology that the disease can be managed or a condition can be managed came after the COVID, significant. And both from a policymakers, I have never seen that kind of a change. Government came out with a lot of policy change. Providers partnered with the digital health providers, technology adopted certain new tools to go and reach to the patients and deliver the care. And lastly, the patients who always wanted a human touch but now believed in the technology that it is equally capable and feasible in healthcare settings to provide the care that they need. What I meant is that digital health is not a new area or a segment. It's actually a tool cutting across all the healthcare value chain, which includes your primary care, secondary care, diagnosis, tertiary care, and all of it. It's not about the digitally enabled AI and ML screening and delivering certain care. The digital health is going to be the part of the entire value chain and the way it will be delivered. So don't think digital as a new segment, new areas of area. It's going to be a tool that's going to help the deliver and achieve the objectives of the care, which is accessible, affordable care, and equitable care to everything. So digital is going to be part of it. Don't ignore it. It's going to be part of it. The way computers became part of the entire lifestyle and every sector, every industry, every workstation, the digital health, or I would say digital, is going to be part of it. You won't find professionals in coming time where you don't know data analytics or you don't understand AI, ML, at least understanding is there. You won't find hospitals and different players who are not utilizing the digital health, data analytics, and the new tools in delivering their care, because it's going to help them to reduce the cost, deliver the better care, and achieve the better objectives, which is the patient care. Yeah. So I think it's a great topic. It's going to see a significant opportunities, and especially with the policy and the change that is happening. The kind of ability of mobile internet access, it's among the highest in the world. We have the right environment to take the digital health to the next level and change the healthcare sector in the country. That's all from my side.
Thank you, Lalit. So you heard that you are the future champions of change, and from Dr. Manchanda, you heard from Mr. Lalit Mistry. It is going to be all-encompassing. So I am throwing a challenge and a food for thought for you, and possibly for the faculty also, that I think everyday things are changing. Sometimes I wonder how you are adapting your curriculum, for example, to that. So I think there is a lot of interesting challenges that are coming your way, and there is no way anyone in healthcare can avoid the digital world now. Also because of, if I may say, I think I was part of that audience when Digital India was announced by the Prime Minister in Delhi about 8-9 years back. I think many had cynicism in heart, but look at what it has happened. I mean, nobody thought that we will go into Paytms and Bheems and all that. I mean, sabji walas are carrying cash, and Om gave the example of mobile in terms of scale. So I think these are all very important snippets coming out. Let's move forward. Let me ask Mr. Kshitiz Kumar for his opening comments, please.
First and foremost, a big congratulations to Jim for 10 years of success. It's my first visit to Jim, and I had the privilege of having a couple of students as summer interns. I'm thoroughly impressed with the infrastructure, with the faculty out there.
This one needs a big hand also.
If you really sharpen your focus and focus on the word metamorphosis in this topic today, I would go back to a Harvard business study which was done in 2016, which spoke about how digital is your industry. So students, if you have not Googled it, please Google it. There is a 2016 study which ranks 23 industries, how digital is your industry. And as expected, banking, media, services are right there on the top. Healthcare was actually below government. That's a reality. Just marginally ahead of fishing, forestry, and I think one more. That's it. So that is what was healthcare, how digital is your industry. If Harvard were to go back, and maybe if you were to go back and do that study again, I'm very, very sure that the metamorphosis has actually happened, and what led to that change is the global pandemic. It is not that the technologies were not there. The technologies were still there. It was our resistance to adopting those technologies which overcame during COVID. Was there a telehealth available at that point of time 10 years back? Yes, it was. Was teleradiology a possibility? Yes, it was. Teleconsultation? Yes. Can you do a remote ICU management? Yes, you could do a lot of stuff. But adoption was resisted to a large extent by the key stakeholders in the system itself, which could include the government from a regulatory perspective, including the doctors, including the industry itself. I think that has changed. And that's going to not stop. So if there is something which is not going to stop, is this momentum that is building up on digital side, that's not going to stop. What that would mean for each one of you is the skill set required now to do healthcare management, which probably 20 years back was different, that's going to change. The skill set required for each one of you as you graduate out of this is definitely going to change. So that would be my opening statement here, saying that, guys, while you're preparing yourself for your next career moves and looking at what do you do after you graduate from here, carry back this message. Life has changed forever in this industry, and you could have probably said a digital would happen. Momentum is going to get bigger and bigger. Thank you.
Thank you, Chiti. So, a simple saying again, necessity is the, change happens because of necessity. So necessity is the mother of invention. So you heard Jayashree, you heard Kshitij. It took a devastating pandemic like COVID, which mankind didn't face after that flu about 100 years back, Spanish flu. And it took that to realize we have it with us, but we are not adapting. So change is the name of the game, and I think we should all be ready, not get scared to face change. To go with the flow is the art of survival. So having said that, may I now request Professor Sean, your very own Sean from the Institute, to give your opening remarks, please.
They hear me all the time. So let me sort of, it takes me back to 2016, 15, so to say. A hard day's job along with a sales guy in a very remote town in UP. We did a joint sales call. We got 30 seconds to make the sales call. The doctor only nodded his head. We walked out. That got me thinking, this cannot be. The point was, can I transform his life? Not the doctors, first the sales guy. That was the genesis of a digital initiative way back then to digitize the entire sales process. Right from what kind of questions can I help him ask, to what kind of answers to sort of preempt, what products to promote, what's the follow-up action, and of course that was the genesis of the digital journey we undertook at J&J. Life has changed a lot after that. You mentioned pandemic. I have a thought on the metamorphosis. The change is there, but the change is difficult. A butterfly cannot fly until it crawls out of that entire cocoon, which pumps blood into its wings. Digitization is here for you to experience. As a curriculum, we built it in, but it would take a really breathtaking effort for you to bring about that change. I am glad conversations are happening now on digitization. Sometime back it was, why digitization? Is my patient there? Is my doctor there? The conversations have now shifted. why not digitization? While digitization may be your mantra, but for me, I think it can be a business pivot for a good set of organizations. While it was an enabler then, today it can transform lives. So with that, I think we can open up to our discussion.
Thank you. Very nice point. And I think it's always good to give an example. So now I'll remember the butterfly and cocoon example, Sean. It's a great example, and why not digitization? See, if I may, before opening, starting the discussion on the 7-8 points, mention this, that being the youngest in this panel, I have seen the most for sure in healthcare. And I look at when I started after my IIT, I thought I was a very high-tech man. I started in Philips, Kshitij's organization, with the same C-arm. I'm giving you some confidence. C-arm, X-ray, and I went to the field to service them. And even today, after X decades, my X kitna bol nahi raha hu, okay? After X decades, C-arm still exists, right? They have not been taken over by any of the subsequent innovations like ultrasound, nuclear medicine, CT scanners. So there is this message also, it's a little contra message I'm giving, that not everything, we are not going to get a tsunami of changes from today, that whatever Professor Ajay and the faculty are teaching, all are, we need to go through the course again for 2 more years. It's not going to be like that. There are a lot of things which you have to manage as healthcare managers after Jim, which are there. Fundamentals of healthcare remain the same, but there are going to be changes, fierce changes with which you have to get you have to fall in love with the changes. Change is going to be the name of the game, but it's not all changes. But I also have a message for the faculty of Jim, that I think if you are reviewing your curriculum once in 6 months or once in a year, I don't exactly know what's the process. Possibly you have to have a short meeting once in a month, the way things are changing, the way you have to adapt to it. So having said that, I'll go to the first of the 7-8, depending on the time factor, topics, and I'll sort of request our eminent panelists to give very quick bullet points. Remember what Einstein said, that if we are not able to explain in simple terms, we ourselves have not understood. So you can give it a pass. There is no problem in that. So first one is, let me ask again, with your permission, Jayashree, we are talking about industry initiatives and collaborations. So examples from the pharma industry or what you have watched in the last few years, what have you seen? Is it a positive development? Are you seeing collaborations and special initiatives happening? People are embracing changes?
So I think if I give my company's example itself, and I talked earlier about how it's looking at digital in a very different manner. If I look at one of the therapy areas that we're invested in, which is neurosciences, now that's a disease area that not only requires skill sets in terms of diagnosis, therapy, but then also a very continuous steady state care that's provided by caregivers and by the treating physician and the associated healthcare practitioners. In this particular space, I think looking at digital health and how can a wearable tool help us and enable the caregiver from a sense of monitoring the patient between consultations, help them getting, get warning signs between consultations on compliance to therapy, on symptoms that basically are a trigger or a risk factor alert saying, hey, let's get this patient to the right medical care. I think that's the biggest example and a tangible one that we're working on that I can give, which talks about collaboration with academia and industry in saying, how can we look at therapy and disease management very differently? And I think going forward, if you see, this has applications across multiple therapy areas. It could be in cardiology, it could be in diabetes, like I think somebody was saying earlier, but multitude of such facets, and I just gave you one example.
Thank you very much, Jayashree. I think that absolutely makes sense. I feel tempted to ask Kshitij the same question, but with a caveat that vis-a-vis what you heard, Jayashree, and I'm sure you have great examples. of such initiatives and collaboration with Philips. You are very active in the industry, FICCI, Nat Health. I feel like asking you, please do add something. What are the messages for our young students here that, how are they going to think about changing their approach, adapting to these new initiatives and collaborations? Kshitij.
Sure. So I think one thing is very, very clear to any stakeholder in healthcare today. Okay, even if you are at a hospital or a clinician, or you are a tech company, or whichever field you are in, I think it has dawned upon, at least in Philips, and I'm sure at a lot of other places, individually, standalone, you'll not be able to change healthcare. It will require, right from government, from a regulation perspective, to tech players, to the healthcare providers, the clinicians, and the academia to come in together to change healthcare. I was pleasantly surprised to see the amount of research work that's going on at JIM, especially on the public health space, financing, a lot of things that you guys have been doing. I was not even aware of it. So it's great to see that kind of work going on. I think in the digital side of it, and I'll just take two examples out there, how we are kind of working at it. We are actively realizing that not everything from an AI tool, etc., will come from Philips, right? So what we have built it up in all our equipments today is a third party, which is called, you could be an AI company, FDA approved AI, let's say a calcium scoring in your CT, right? And that's called a marketplace. You could actually say that, okay, on the marketplace, Philips, can you host my AI and do that? And we are more than happy to host that. So that's the kind of thing, that collaboration, saying that, okay, it's not going to come only from the large companies, it's going to come from a lot of smaller players which will be coming in, and we will actually act as a conduit to take that from a small to a large global platform where anybody can use that, and it will be like kind of a revenue sharing model, saying that, okay, if you use this application on CT, this much amount of money goes here, this much amount goes here, etc., etc. So those are the business models out there. But it's very, very evident that this is the way of going forward. It cannot be like everything is done by us. The second part, and I think which gives me a lot of pride, is about the collaboration that as a company we do in India is we have over 20 more and adding with institutes like AIMS, Sri Chitra, Nimhans, where Philips collaborates very closely with the clinicians, the work that is being done in India. So we actually sign up with them and help jointly to solve the problems for India and for the globe. And that's a work that we are already doing, saying that we cannot be, as tech company, be defining something to happen only to realize that clinician had not even asked for it. So that's the second part of the collaboration engine we are doing. And I know in interest of time, I'm going to pause at these two. There are many, many more on that.
No, fantastic. I can tell you, sitting in the same chair in Philips 20 years back, it was unthinkable that, you'll be, and I'll give a twist to what is it relevant, how this is relevant for all of you, the students. When we had from the big equipments, the smaller equipments, for example, the ultrasound, the monitors, and I started getting worried that how I can have a direct team. We are only direct organization, and this is directly managerial, relevant for you. How on earth are we going to manage it? So when I first proposed that we have whatever you call alternate channel, third parties, indirect channel, I think I was in Philips headquarters, I was looked upon somebody who has gone crazy. But cutting a long story short, in a moment of fun, I said that is the part of the organization which will overtake the capital equipment, if I may say. So I don't know what is the number today, but at least when I moved, retired from Philips, already it had overtaken. It was like 55 versus 45. And that alternate channel, like Kshitij, you mentioned that one of the students did organize a very beautiful dealer training program. There was nothing called dealer distributor in healthcare. And then we extended that today to customer support. That was even more unthinkable. It was sacrilege to give your technicality to an outsider. It is no more. And in digital health, it will be all the more relevant because all the barriers and frontiers will be broken. So I think a message for both students and faculty is possibly more doses of change management, more doses of alternate channel management, because these are the managerial talent that will go out into the industry. So if one student of yours, Professor Ajay, has been able to impress the CEO of Philips by organizing a terrific dealer channel meeting, how important that is. It wasn't important 10 years, 15 years back. So these are great points. Let me quickly come to Om again, with your permission, for the next point. Key challenges and opportunities in implementing. Key is implementation. You can announce a lot of theories in the country, for the nation, or for companies. Key is implementation. So you, as a outstanding practitioner from the biggest diagnostic company, please, we would like to hear you.
Yeah, I think I can go on and on this topic because I've been through it myself for the last 6-7 years. I'll try and summarize it in a couple of minutes for all of you. So I think first message, irrespective whether you're in healthcare or anywhere else, if you're managing an organization or managing a business, my message to all of you is that if you're stuck with something, please don't try and copy someone else, but just put yourself in customer shoes or consumer shoes or patient shoes and ask simple question, what is the problem that you're trying to solve? That's the first message I have. Otherwise, you may actually end up copying somebody else. That fellow may be going in a different direction. You also may end up going in that direction. But ultimately, you're solving customer problem. Second message is I often get, because being a listed company, we get surrounded by all kinds of advices and questions, etc. There is a buzzword called there are new age companies and there are old companies, right? There are digital companies, there are fuddy-duddy, old daddy, I don't know, whatever you call it. But your customers are actually both. I have a customer who's 80-year-old patient. That person wants to see the same phlebotomist coming to his or her house, collecting blood samples. He's least bothered about the app. Similarly, look at banking. I'm sure all of us have old parents or whatever relatives at home. They still want to go to the bank, draw a check, draw the money. Unless they do the same thing, they will not get the satisfaction. There are people who still want to go to ATM and draw the money, feel good about this, while the same job can still be done online. And children at home will be laughing at that old person as to why this fellow has not changed. But fact of the matter is you have all customers. So in my simple message to all of you, there is nothing called new age, there is nothing called old age, it's a hybrid format. Today I have a customer base which runs from 15 years to 80 years. So they are digital, tech savvy versus completely old fashioned as well. So this is second thing. Now, in terms of opportunities, I see this as all of us ultimately have to build a competitive advantage, whether it's your own career, whether it's your own business. I think digital is a big opportunity to create that competitive advantage because this is that differentiator. If you do it well, it can put you ahead of others. So I think it's a big competitive advantage. Second is it does smoothen the entire operations. Let's say diagnostics is a very, very highly broken chain because for a patient you give a blood sample and get a report. But what happens in between, none of you would know, I would know. The sample changes at least 7 hands before a report comes in your hand. And virtually at every step there is an error which is possible. Now automation or digital actually is a big opportunity. You know, often we talk about this, you go to somebody's house, collect 2 samples and you get a message that I have a good news because my diabetes is okay now, but I have a bad news, my wife is positive now because you just mixed up the sample. So, you know, simple errors like this can actually cause a lot of problems in your business. I think digital solutions are helping in controlling a lot of quality processes. So that's a big opportunity. Now, I think I'll quickly touch upon the challenges. I know I can go on and on that. It's my favorite topic. One of the biggest challenges companies are facing is that everybody knows we have to change, but who will drive that change is a big problem. A leader who is maybe a person like me in late 50s has no clue about what this is all about. He has only heard in these conferences some fancy words. Inside, he or she is worried about change because it can be a risk also. I think you are the person who really has to bring that confidence in the organization and saying that this change is required and I am here to make it happen. I think you will have to bring in a lot of confidence wherever you work, whichever organization, confidence to the leadership that I am here to bring that change. So to my mind, it's an issue at both levels. Many companies are just visualize a traffic jam and people are moving from this direction. In India, we see a lot of traffic jams at crossing, but suddenly it takes one cop to come and discipline the whole traffic and make sure everything goes smoothly. I think you require both that leader and also a person who will bring that change. To my mind, a lot of time actually gets spent in legacy companies that they know that we have to change, but they are not able to make that first move. I think that's where the challenge actually lies in implementing some of these digital solutions.
Very wonderful points. Even, I think, first of all, admitting that top leaders also are deep inside worried of change. To me, that's one of the biggest leadership characteristics, to admit that yes, change is something that worries us also. I'm seriously, and that's wonderful. And then the hybrid thing that you mentioned. Lalit, now we are going to be, I know Ajay is very sharply looking at me and I'm looking at the watch. So I'm looking at the watch. So we'll see how it goes. But now it has to be very, what do you call, rapid fires. So can you give rapid fire?
I'll make quick.
Yeah, we have 17 minutes. So rapid fire on the same. Okay. Challenge opportunity.
So I'll focus more on the digital health. If you look at the entire healthcare value chain, whether it is general practitioners, patients, nursing home, you have hospitals, you have the manufacturers like pharma, medical devices, all. The biggest challenge in the healthcare is that most of this is fragmented and disconnected. By digitization, one of the area, so for example, digitizing the general practitioners or having a self-care or primary care, all of this is not going to help unless you do the digitization across the value chain. That's the first point. The second very important point is the entire value chain is fragmented and it requires a connection, which we call as connecting the dots. Unless you connect the dots, this entire value chain, the data that is created at the patient level will not flow across the care providers and the decision makers. The value of the digital health will not be created for the ultimate consumer, which is a patient. It's not going to happen. If you do just provide a mobile app for a patient and you don't have those medical record with the general practitioner or at the time of a surgery or where the disease is managed, there's no point of doing that. That's a second point here. The third very important point is that digital literacy is going to be the big challenge. The understanding that what is the digital health, how does it impact, where it needs to be adopted and how it can help them to, provide their services better and how can it aid them. Lastly, very important point is that the digital health in other sector is very much easily be implemented. But when it comes to healthcare, the complexities and the multidimensional of the healthcare sector makes it very limiting to get easily adopted. You can have a digital for a food delivery and you can have e-commerce and offer. But there are thousands of diseases. There are thousands of treatment. There are thousands of conditions that can be created. So it's very difficult for even a doctor to look at a case and say that, okay, this is the right diagnosis. So trust me, digital is never going to replace the core of the healthcare value chain, which is the doctors, hospitals, and diagnosis, all that. It will only enable the entire care delivery by reducing the cost, increasing the speed, and more precision in what they deliver to it. So I think that's what the digital health is going to be there in going forward.
Thank you, Lalit. Good points. Let me come to you, Sean. I know Jim focuses on entrepreneurship and innovation. You have your very own Atal Center of Innovation, etc. So just give us a view of past versus present versus future as you foresee in terms of academia cultivating innovation, cultivating. I'm purpose like the word metamorphosis was selected by some of us after a lot of discussion. Change was sounding very watery in today's world. Transformation is also, not so intense. Metamorphosis sounded like more what's happening now. So how do you foresee, how shall you adapt or the students adapt in terms of entrepreneurship, innovation? Any quick thoughts?
Yeah, so we are quite fortunate to have Atal Incubation Center here. At the same time, I also interact with a lot of startups and we do have those deliberations and discussions. The problems of yesterday are a lot different from the problems of today. There are a lot of healthcare startups in that eco space who are brilliant in tech. Brilliant. I mean, the tech is there. But here's the challenge. They don't have an ecosystem to sort of collaborate and work and make a market entry that is quite fast. I'll just explain from the entire, we can start with the investor funding, right? And therefore, alignment between investor funding and startups has to be more streamlined. The expectations of return on investment timelines plays a very important role when it comes to healthcare. The outcomes might take some time, but it's a buzzword. Healthcare is the next big thing. Digitization is here to stay, of course. But if investors are not aligned, then the right kind of investments, that's one. Second is I have tech, but it's not as simple as selling soap. Where is the data? Where are the evidences? And therefore, if there is a structured approach to help them scale up and get those evidences, nothing like it. Third point, regulatory. And therefore, regulatory hurdles again, specifically for entrepreneurs in healthcare, is a different ball game altogether. So these sort of challenges I can see in that ecosystem, right from funding to regulatory, and that, like you rightly said, that pot is a melting of ideas. That's true. That's concrete. But it has to have a market entry, and therefore the right kind of mentorships to help them enter that market space. It's a great product, but if it does not see the light of day, or rather commercialization, I would so to say, is the other big thing which they struggle with. It's great tech, but it has to be commercialized to be viable.
No, thank you. So, taking on from there, I'll ask you to continue with these thoughts. Do you foresee a radical, disruptive change in the needs for industry, academia partnerships? I mean, this is a very specific question relevant to GIM, to all your students, to the faculty. So, for example, today you have got Philip sitting here, Lal Path and Jansen, and there are other industry top leaders who have been here in the last conferences. So do you foresee that you need to rethink about the kind of partnerships, collaborations? Would you like to collaborate with maybe, I don't know, I'm just throwing some idea, private equity, venture capitalists, accelerator companies. I myself am lead mentor of India Accelerator, which is India's #1 accelerator. And I'm seeing every week what you said, brilliant ideas, but far from ground reality. So would you, quick question, academia, industry, collaboration, do you foresee adapting needs?
Yeah, definitely. I think it takes some amount of time for an innovation which happens in the industry to get into the classroom. If that time can be bridged, you have innovation coming into the minds of the budding managers passing out tomorrow. So if that collaboration goes up in terms of experience sharing, that's one. Second is the funding for research, right? So while so far most of the research that we do essentially comes from either WHO or any of the other legacy organization, private industry funding seems to be sort of scarce, so to say. Specifically when it comes to health, measurement of health outcomes, and if we can sort of have some kind of thought there, some kind of process, maybe the flow has to be there, maybe a project has to kickstart it, but I see there is definitely some scope for improvement. Let me give a small example, and that will probably set the ball, what I'm trying to say. Last year I did a small project with couple of students in the final year, and of course won't name the company, won't name the brand, but with so much data available with digitization, we did a sentiment analysis on the drug, and it's amazing results. And I was wondering whether the organization ever knows what his customers are thinking. You don't have to wait for the sales guy, you don't have to wait for...
Amazingly good or amazingly bad?
Amazingly good, the kind of raw data that you have available now at your fingertips. And of course, we were looking at positive sentiment. There were positive and negative sentiments to the entire drug and things like that, but it's an opportunity.
Jayashree, can I just ask you on this point, because I know as pharma leaders, you do a whole lot of, interaction, training, etc. Would you like to elaborate on that, as a practicing senior leader in pharma industry? Do you see transformational possibility which needed from both sides?
Absolutely agree. I think couldn't agree more. So if I take the example of Pharm and my own company, we have an organization called as J Labs that collaborates a lot with startups and entrepreneurs. And in fact, it's not about funding them in their early stage, but also providing them mentorship. And there are in-house mentors from medical devices, from pharmaceuticals and earlier consumer that were helping them go on this journey. And there were skill sets that were available not just in pure discovery, but also in commercialization, in financing. And our effort is how do we bring these entrepreneurs to go ahead and apply to that particular effort within J&J. I think closer to this group, what I'd love to share is it's been probably a couple of years now that we've started this initiative called as Imagivators. Now what this does is instead of going through a traditional summer internship, winter internship, it's actually getting young talent like yourself into the organization saying, hey, here is a business problem or here is a technology problem that we'd love for you to work with, and then take it forward. And then you have an enriching experience not just for you all, but also for us, because then there are solutions that we go back and say, okay, how do we implement it? In fact, just yesterday I was talking to one of your students and she was saying, what's happening to my project? And I said, well, it's getting implemented because there is value in that fresh thinking. So I think there are elements that we do. Can we do more? Definitely, yes.
Excellent. I love, this is another thing I'm going to pick up. Imaginators, you said.
Imagivators.
Imagivators. Yes. And can you just explain briefly for those of us who are ignorant about it?
It's an immersion program for business school students in the first year. We get them into our organization. They get to experience leadership styles, leaders, and then of course discuss business problems.
Wonderful.
As well.
Thank you very much, Jayashree. I'll now go to a subject which is relevant to entire healthcare sector, and definitely with the advent, you heard it for the last 50 minutes, digital, the way it is coming up, and that is ethics. And I'm going to ask Kshitij and Om, I wish I could ask all of you. You all come from great, eminent organizations focused on ensuring that ethics happens. And just to cover some quick points, ethical considerations in digital is also related to data privacy, security. For example, privacy, not only for the patients, but for citizens, for all stakeholders. We heard from Kshitij the alternate channel requirement, if I may say. So I think the concerned organization has responsibility, hospital for patients, but MedTech also has, diagnostic has. So would you quickly like to, I know it's a subject that can take 2 hours, but we don't want to create more concern in Professor Ajay. So very quick, top of the mind thinking from both of you, Kshitij and Om.
Yeah, this is another area I've been through a tough time. I think it's a big challenge in general we see on privacy and confidentiality, and I think in healthcare particularly, as we all know, the entire chain is broken and it's not a level playing field. Like say for example, our business model, we deal with a lot of smaller labs, pickup points, hospitals. Their IT systems may not be exactly the way your IT systems are. The patient flow into our system is very, very different. I have 1/3 of the patient who actually walk into my labs I have a little better control on that data. Another 1/3 comes through my collection center network, which is entire franchised out network, does not operate at a scale. They don't have that kind of investment that we have. Similarly, these digital solutions that are coming in, most actually legacy companies, they work on enterprise solutions and on-prem servers. We are not on cloud. That transition is yet to happen. And then you get young person who is trying to make digital solutions for you. You're only focused on upsides, but you don't know something is happening below you. You have no idea about it. I have personally been through those incidences during even COVID as well. I think the only solution is that nearly about very large part of my spend these days is actually on data privacy and security. And something very new to me, I really learned it in the last 3 years, terms like VAPT, and then we have data security centers, SOC, and all that sort of thing. And I can only say that we are nearly spending about 1% of our turnover only on this area. Then there are issues of a different kind you actually come across. I probably may want to share one real life examples which happened just about a week back. We use this data for promotions, and the data uses multiple ways you can do. You can do anonymized data, use it for research purpose. I'm not going into that. I think the low-hanging fruit for most organizations use this data for promotions, right? Now, cost of a mistake in any other business is a refund, right? If something goes wrong, they'll give you a refund, take it. They'll give you one extra voucher also. But cost of a mistake in healthcare is not a refund. And it's actually can be very, very damaging to the brand if you don't really are very sensitive to what you're doing. And I'll give you a real life example which I just went through last week. We do these messages for promotions, right? Your test is due, you have not been to us for last 4 months, these health packages, etc. So here is a patient who writes to me saying that I'm very tired of these messages. I get a message on my wife's phone that please come for a health checkup, but for your information, my wife passed away 3 months back. And every time I get this message, it hurts me. It made me think that, am I doing something wrong in the system? I went to my marketing person, I said, this is the problem I have. The first reaction I get, oh, this is the reality, you will have such situation, but can you stop these marketing programs? But listen, I said, I know the benefit of that, but I also want a solution to this problem. And how do we solve this? And this is a real life problem. So I actually wrote back to this gentleman apologizing and regretting and all that stuff. And 3 days later, he again gets another message. And he writes to me, Saab, is company mein to aapki bhi nahi chalti hai. So it hurts me now. So I actually had this message, somehow I just figured it out and we blocked his number. Now he has another problem. Why have you blocked my number? Because I was getting some useful information from you, which now will stop coming to me. Now, these are all issues of these digital initiatives which sound very glamorous and this thing, but there are downsides to all this. We have to be very, very careful as to how do we really implement some of these digital solutions. And I think things are evolving, but my message to all of you, since we are all in healthcare, I think these are not cut and paste digital initiatives we should do from what we get from Swiggy and Zomato, etc. I think healthcare, we need to be more sensitive towards patient care. That's where I think solutions are more hybrid in nature rather than only digital. That's what I would say.
Absolutely super excellent points. Om, thank you very much. You know,
there are many more I can share with you. But,
yeah,
this is
so
one such
catch him in the lunchtime. And you know, I mean, the word, as Om was talking, as a technologist myself, the word Frankenstein came to my mind. I mean, you can't avoid it, right? This world, as the minister himself also said, very rightly so, this world is going to remain. Everyone has said that. And whenever that happens, there are going to be monsters lurking around. And I suddenly feel excited, you know, like I wish I was your age and I would like to enter this world with leadership opportunities to handle this, you know, change management of a different level. So I think it's a very exciting time for all of you. Shitish, I know I worked for Philips like you do and how ethical considerations matter, but you heard one example which is very touching actually, Om. The example you gave is very touching, you know. By the way, I'll tell you during lunchtime what message I get, in whose name. Okay, later. It can create a massacre actually. So please, Kshitish.
Okay. I think Om spoke about a specific example in an organization, right? How on a consumer-facing side, this can be a big issue. But let me take you to a different setting where you're actually operating into a hospital. Some of you might have heard about AIM systems being down for 10 days, etc., right? Nobody knows how it happens. I don't know, opposition party Anjanda is putting in my ear, but I don't think that's the case. Yeah, so, but I just want you guys to imagine in a hospital, okay, there are different players that come in. There are different providers of MRI, there's a different provider for a lab, there's a different hospital information system, there's a lab information system, and imagine a situation where your actually data is at threat from various other sources. Because it's still easy for an organization to put a data security for their own network, but if you're operating a hospital and a chain of hospitals even more, and you've got various products, vendors working with you, and by the way, most of the systems are connected backwards, right? So when we do a remote resolution of an MRI CT scans, I'm actually able to access your machine remotely. These are the threats that come in when we talk about a data privacy, etc., and not just about saying that, okay, I'm kind of insulating myself, my own hospital information system is secure. So that is one big element beyond the consumer part, which Om eloquently explained, that could be a potential one from a consumer-facing one. But when you are operating and you're managing a hospital or a healthcare network, those are other challenges that say like, okay, how sure are you that the vendor that you're working with has the same data requirements, security requirements that your hospital operates at? Because then that point, you connect it in your hospital, becomes your failure point without you actually knowing it. And how many times do we actually, when we ask for a quotation and say like, hey, I want to buy this, how secure is your system? Because we don't do that today, because we were not born to be doing that one. We were asking, hey, can your machine do this? Can you do this? Can you do this number of scans? Can you do this number of tests? That's what we do. We do not ask in this digital world, how secure is your system in the first place? Because now when I integrate it in my hospital, that could be the next big weakness.
Sure. Thank you. So again, relevant to the students here, if I may say, so you are going to jump on to this excitingly changing world, and change management, I think, is an important element of what you are going to learn here. It's given that all these things will happen. Someone will be accountable in those organizations. You can't say that, I'm sorry, someone hacked my system. You will be asked why you can't manage it, etc., etc. So these are real life exciting stuff that are coming from these realities. All good things have to come to an end, unfortunately. And now to give me a message, I think Professor Ajay has left the scene also. Where is he? Okay. Now we will take, I thought I'll take the opportunity, those of you who follow soccer or hockey, you know injury time, right? We are on injury time right now. So 90 minutes was curtailed to 60. Now we are about 4 or 5 minutes. So we will have to come to the conclusion of this discussion. And I'm not going to do sum up for this brilliant session, because there are notes. Jayashree is looking at my notes. I have made notes which I'll send to Professor Ajay later, and I think that will be a curriculum itself. So brilliant discussion, but I'll request each of the eminent panelists to give your sound bites. At the end of, let's see how we can follow Einstein. Make things simple. You know, if you can't explain things in a simple way, then we have not understood it. That's a fair conclusion. If we have not understood digital health fully, I would say that's fair enough. But I'm requesting starting from Lalit, we go in this order. Please go ahead and help me sum up from your side. And we'll take another 5 minutes and come to the end of this session.
I think I'll make only one point. Digitize the data at the point of creation and secure the data at the point of creation. That's going to be the key for whether it is a mobile app, whether it is in the hospitals, whether it is in the clinic. If you can't digitize a data at that point of creation, and also you can't secure it, trust me, you are landing into big troubles. Okay, and this digitization journey will never start in the country where you have a multiple fragmented system. So best of luck, and I surely think that you guys have a big opportunity as well an exciting journey to embark on, and also great challenges to witness and to overcome. Best of luck.
Thank you.
Yeah, I think I probably will give two messages. One is related to security. I think we didn't have enough time to talk about this, but to my mind, this is a very big issue as you embark on this journey of digital healthcare. I think at the same time you must focus on what are the downsides of it. You will only realize if you have a problem, otherwise life just goes on. Like the way we do fire drills, I think you should actually do digital issues or whatever security issues, do those drills, you will actually know what the problems are. Second is, which is general message to all of you, think of digital more as an enabler than the end point. It's a means to an end, not an end itself.
I think I'll repeat a little bit because in Philips what we say is your base actually starts with data security. Okay, it is not the number 2 or number 3. It is by far the number 1 piece in the digital world that you have to be safe and secure about it. Right from a product perspective to the system integration, everything has to be secure. Okay, so that's piece number 1. Second, I think message I'll give to all the students here, embrace this. And in some sense, you guys are lucky because you're born into it. You're a native digital people. You should embrace this and continue doing that because 10 years later, 15 years later, you guys will be here on this side and saying the same message to other side. Technology wouldn't have changed, but your attitude to keep on learning new things should not change.
Thank you, Kshitij. Excellent. I'm wondering 10, 15 years later where I will be, which side? Jayashree.
I think our panelists have said it all. I'd probably add that look at digital health from 2 facets. One, that it has to be an open system connecting and talking to a wide array of systems for it to make an impact. It cannot be in a silo. And then the other facet is it also has an expectation of being personalized, customized for that particular individual. So how do you manage this paradox will also be very, very important as we go ahead and expand digital health.
So for me, so digital is not an option. It's here to stay. So if digital is not an option, it has to be a journey. Think about it as a journey. Think about your own. So I mean, the first thing that probably I would ask you to prepare is what's your digital roadmap and what's your current digital footprint. If we can probably ponder on that, I think it's going to be a journey worthwhile for every one of you.
Thank you, Sean. Well, as I said, all good things have to come to an end. So I'm taking the liberty, being the so-called moderator, to conclude it by a small episode from my own life, very non-digital, completely analog example. So I think when I was as young as you guys were, we used to attend this famous annual ritual conference, Kshitij will know, called RSNA, Radiological Society of North America. That's the big halla-gulla trade show in the healthcare world, considering all segments. In Chicago every year, in biting cold, and we used to have fun. So much of learning, all global companies go there. McCormick Place, right? Yeah, 50,000 people, that's the world's biggest trade center. And मैं ये क्यों बोल रहा हूँ, वो तो हो गया. After that, you know, young we were, and we said, let's go to Disneyland before returning to India. So we went to Disneyland, and it was fascinating for our 20-something year young guy, and all of us were fascinated. But what has stuck on to my mind after so many decades is a small placard that was there outside Disneyland, which said, "This work shall remain incomplete till human imagination lasts." Just so that impact is felt, I'll repeat. So to us, we are saying this is the ultimate in technology at that time. I'm talking about 35 years back or more perhaps. But you feel humbled by that admission. This work shall remain incomplete as long as human imagination lasts. That's the reality. We have discussed a lot of things. Tomorrow these things may change. So it's the world of changes, exciting world. Enjoy it. Thank you very much.
It was an absolute pleasure and delight to be enriched with such fruitful discussion. Thank you, everyone. We would like to extend our gratitude and felicitate the esteemed panel. We request Professor Ajit Paurlekar to felicitate the panel one. Question answer session was planned, but because of the time management challenge, I didn't go for that. If Professor Ajay allows, then we can still have it, informally during lunchtime. Yeah, informally at lunch is good, Professor Ajit is saying. So I thought. Thank you. Thank you, everyone. Now let's take a quick lunch break, and I request everybody to be present in this auditorium by at best by 2:55 p.m. We shall sharply start at 3 p.m. with panel 2. Thank you, everyone.
We are GIM, Goa Institute of Management, spread across 50 acres of land
with 5 distinct programs.
We are Inspired, founded by Father Romuald D'Souza, one of India's most recognized contributors to the field of management studies. We echo ethical leadership through our thought leader interactions, pedagogy and affiliations. We are diverse. Everyone is a minority at GIM. Our students come from all walks of life, from all across the country and beyond.
Assam, Andaman Nicobar Islands, West Bengal, Goa, Haryana.
We are a community with over 3,000 influential alumni spread across 15 countries, distinguished faculty and global partner campuses. We are responsible. With our Give Goa initiative, our students work closely with NGOs to develop surrounding communities. We are responsive. GIM engages with business and industry and our society to ensure that our programs meet their needs. Our innovation lab Big data analytics, healthcare management programs, and gamification learning are some of the things that ensure that we teach the right thing the right way. We are growing and raising the bar. Our placement committee helps students seize career opportunities that help achieve predetermined goals. We are fun. With varied on-campus activities, we provide holistic, non-classroom learning and community building. We are one with nature. Nestled on a picturesque hillock in Goa, our campus sets the perfect stage for easy and comprehensive development of our students. We are excited for our future and the leaders we make. That's why we are GIM, Goa Institute of Management, School of Next Marking Management Studies.
Welcome to GIM. This 50 acres landscape is the home ground of sustainability. Here we create responsible managers for tomorrow because sustainability runs in the DNA of GIM. So we can proudly say grass is always greener on our side. But how have we achieved this? Solar plant is a major energy source at GIM. Energy consumption is monitored and audited. LED lighting saves energy. The pool transport system reduced both oil consumption and CO2 emissions. GIM hosts a rainwater harvesting pond, an atmospheric water generator, and 2 sewage treatment plants. Bean-wise segregation scheme treats dry and wet waste. The plant species in the campus are documented and published as Floral Biodiversity Register and Coffee Table Book. The faunal diversity within the campus project is in progress. GIM CESD has completed projects funded by Finnish National Agency and German Development Institute. GIM CESD is a part of Sustainability Centers community with 150 other global sustainability centers. The Give Goa initiative upholds sustainability among local communities to student projects. 87 projects have been completed in the last 5 years. Sustainability Hackathon is conducted every year to encourage and reward innovative ideas to develop sustainable campuses. The No More Use and Throw campaign by GIM students has already saved 96,000 paper cups. GIM has contributed towards the Green Industries Goa campaign. Sustainability Horizon disseminates the knowledge and practices of sustainability. All our support staffs come from local communities with almost 50% rural work.
This is how.
The grass is always greener on our side.
This is how.
Our responsible managers make it green. On the other side as well.
This is how.
We will be a net zero campus in the near future.
Give Goa is a unique program, and through this program, students are oriented towards the social sensitivity. Students go out in the community and work with underprivileged section of the society. Development of empathy and humility is done through this Give Goa projects.
Give Goa gives the students of GIM to work on a range of projects which can be in the field of agriculture, in rainwater harvesting, financial inclusion. A lot of health projects students take up as part of their Give Goa course. Basically what Give Goa does is to sensitize students about the grand challenges that the society has. It also helps students to enhance a lot of their skill sets and also teaches them to build new skill sets. Now these skill sets could be communication, teamwork, strategy. Give Goa helps them to innovate, to understand how do they strategize when they are faced with challenges. As they learn in the classroom, they have the opportunity to go out and directly experiment what works when faced with a real life problem. They undergo a sensing journey, they interact with various stakeholders, understand their pain points, and then strategize. Give Goa adopts a design thinking approach And I think it is a fantastic way of teaching the students how to be responsible leaders in the industry which they would join after the 2-year course.
The healthcare management program at the Goa Institute of Management was started in the year 2013. Over these last 8 years, we've been able to benefit over 500 students. A lot of these students today are employed in some of the best organizations in the country, and many of them now work in various parts of the world. This program has helped shape and benefit the overall healthcare industry in the country. Today we have a large number of our faculty and our students who influence, in a small way, health policy.
It's a niche and holistic program by design. We impart cutting-edge knowledge and skills in 6 different verticals of healthcare management. This allows our students to be at the top of all aspects of healthcare management, including marketing, sales and distribution, operations, finance, and most importantly, ethical and responsible leadership.
Digitalization is going to be the norm of healthcare. The COVID pandemic has only accelerated the pace of digital transformation. Technology innovations led by big tech companies and startups are driving the adoption of technology not just for the provision of healthcare, but also for B2B transaction between hospitals, big pharmas, laboratories and medical equipment companies, changing the landscape of healthcare sector.
Designing meaningful innovations is a key to success in healthcare. Healthcare sector is the biggest one to witness startup growth, not only in India, but across the world. The future managers need to learn the art of innovation, and we are proud that our curriculum imparts the knowledge on all facets of innovation and encourages the students to innovate with a strong purpose.
Our collaborative research work with and for national and international organizations of repute gives us the opportunity to contribute in some way to building more equitable and efficient health systems and to public health policy. We then bring these learnings into the classroom where we can discuss them and engage with our students.
We believe in experiential learning, hence we take our students to hospitals, pharmaceutical plants, where students work on live projects where they implement all that they learn in class.
The curriculum of HCM program is designed in such a way that it helps students, the future healthcare professionals, to equip themselves not only with core competencies but also soft skills which are essential while dealing with diverse clients from the field. We give practical exposures to students through different innovative technologies of teaching. We do book reviews, we do film reviews, we do panel discussions from various experts from the field so that the students are aware about the current developments of the field nationally and internationally.
One of the mission objectives of the Goa Institute of Management is to create socially sensitive and responsible managers. To this end, we offer a unique service learning program known as the Give Goa Health. The Give Goa Health enables students to work with an NGO for a year and help them solve a range of their managerial problems. Give Goa Health is very special because it makes the students socially sensitive, allows the students to interact with the client, the community, understand their needs and come up with effective and very creative solutions.
We encourage students' mobility across the borders through our international exchange programs. We are in collaboration with some universities in Europe, Southeast Asia and North America and even in sub-Saharan African countries. So the students will get an opportunity to spend one term in the collaborating universities, and they will get the exposure from the experts from that particular universities.
To ensure that students actually learn to manage this VUCA world, most of our courses essentially gets incorporated with simulations, putting them into real life scenarios in which the simulations themselves are tweaked so as to bring about that volatility. Case studies is another interesting pedagogy which I use to ensure the students are able to take decisions in this complex and ambiguous environment. Each of these pedagogies are used specifically in the courses of new product development, marketing management, sales and distribution, and therefore really trying to bring out the best of students and build those leadership skills which our VUCA world really aspires them to have.
As the world is shrinking and the managers are becoming more global, we provide in-depth knowledge of healthcare systems in the leading countries of the world. We also invite thought leaders and experts which interact with our students so that they can learn from the achievers themselves.
This is not Wall Street. This is the finance lab at the Goa Institute of Management, or as we call it, GIM. But there's more to GIM to dive into. This is the gym, where students do half of the heavy lifting, not the kind of B school is known for. And this is Jaggu, who students visit to take the load off. He has refreshments, munchies from his well-stocked daily needs store, and a whole lot of chuckles. This is the library for the silence and food for thought. It's open 24/7. And for some food for the belly, this is the mess. It's the opposite of messy. And as much as the food is balanced by a team of 3 master chefs curating Indian and continental cuisines, it'll take you back to your mom's kitchen. And this is where your mom will expect you to spend most of your time. And professors too. Lumbar support? Check. Surround PR system? Check. Disconnect from the outside world? Not so much. This is Aravalam Waterfall, a few minutes away from campus. Connection with nature? Check. This is the special tree. It's just peaceful to be around it. And right around it, here's the prayer room for those midweek blessings, or the ones you might need before placements. But would you? This is Sujaya Rajkova, all set for her placement interview. She's not nervous at all. 100% placement record? Check. This is the multi-purpose hall. It can house 4 fighter jets, as much as it can host convocations, badminton tournaments, and thought leadership sessions, like the peace session we held with the Dalai Lama. Speaking of peace, this is the view that students wake up to. This is the sky at sunset. And this is the sky at midnight. But there are no bedtimes at GIM. In fact, midnight is when the life of the campus begins to spark. These are a few fun events hosted by many of the student-driven clubs. Clubs that complete the campus life. And for whatever's left incomplete, this is the maintenance team who will help you fix a tap leak and climate change by installing solar power systems. With over 75 professors, 50-acre campus, and 6 programs, this is GIM, the B School gem in Goa.
We are GIM, Goa Institute of Management, spread across 50 acres of land
with 5 distinct programs.
We are Inspired, founded by Father Romuald D'Souza, one of India's most recognized contributors to the field of management studies, we echo ethical leadership through our thought leader interactions, pedagogy, and affiliations. We are diverse. Everyone is a minority at GIM. Our students come from all walks of life, from all across the country and beyond.
Assam, Andaman Nicobar Islands, West Bengal, Goa, Haryana.
We are a community with over 3,000 influential alumni spread across 15 countries, distinguished faculty and global partner campuses. We are responsible. With our Give Goa initiative, our students work closely with NGOs to develop surrounding communities. We are responsive. GIM engages with business and industry and our society to ensure that our programs meet their needs. Our innovation lab, big data analytics, healthcare management programs and gamification learning are some of the things that ensure that we teach the right thing the right way. We are growing and raising the bar. Our placement committee helps students seize career opportunities that help achieve predetermined goals. We are fun. With varied on-campus activities, we provide holistic, non-classroom learning and community building. We are one with nature. Nestled on a picturesque hillock in Goa, our campus sets the perfect stage for easy and comprehensive development of our students. We are excited for our future and the leaders we make. That's why we are GIM, Goa Institute of Management, School of Next Marking Management Studies.
Welcome to GIM. This 50 acres landscape is the home ground of sustainability. Here we create responsible managers for tomorrow because sustainability runs in the DNA of GIM. So we can proudly say grass is always greener on our side. But how have we achieved this? Solar plant is a major energy source at GIM. Energy consumption is monitored and audited. LED lighting saves energy. The pool transport system reduced both oil consumption and CO2 emissions. GIM boasts a rainwater harvesting pond, an atmospheric water generator, and 2 sewage treatment plants. Bin-wise segregation scheme treats dry and wet waste. The plant species in the campus are documented and published as Floral Biodiversity Register and Coffee Table Book. The faunal diversity within the campus project is in progress. GIM CSD has completed projects funded by Finnish National Agency and German Development Institute. GIM CSD is a part of Sustainability Centers community with 150 other global sustainability centers. The Give Goa initiative upholds sustainability among local communities to student projects. 87 projects have been completed in the last 5 years. Sustainability Hackathon is conducted every year to encourage and reward innovative ideas to develop sustainable campuses. The No More Use and Throw campaign by GIM students has already saved 96,000 paper cups. GIM has contributed towards the Green Industries Goa campaign. Sustainability Horizon disseminates the knowledge and practices of sustainability. All our support staffs come from local communities with almost 50% rural women.
This is how.
The grass is always greener on our side.
This is how.
Our responsible managers make it green. On the other side as well.
This is how.
We will be a net zero campus in the near future.
Give Goa is a unique program, and through this program, students are oriented towards the social sensitivity. Students go out in the community and work with underprivileged section of the society. Development of empathy and humility is done through this Give Goa projects.
Give Goa gives the students of GIM to work on a range of projects which can be in the field of agriculture, in rainwater harvesting, financial inclusion, a lot of health projects students take up as part of their Give Goa course. Basically what Give Goa does is to sensitize students about the grand challenges that the society has. It also helps students to enhance a lot of their skill sets and also teaches them to build new skill sets. Now these skill sets could be communication, teamwork, strategy. Give Goa helps them to innovate, to understand how do they strategize when they are faced with challenges. As they learn in the classroom, they have the opportunity to go out and directly experiment what works when faced with a real life problem. They undergo a sensing journey. They interact with various stakeholders, understand their pain points, and then strategize. Give Goa adopts a design thinking approach, and I think it is a fantastic way of teaching the students how to be responsible leaders in the industry which they would join after the 2-year course.
The healthcare management program at the Goa Institute of Management was started in the year 2013. Over these last 8 years, we've been able to benefit over 500 students. A lot of these students today are employed in some of the best organizations in the country, and many of them now work in various parts of the world. This program has helped shape and benefit the overall healthcare industry in the country. Today we have a large number of our faculty and our students who influence, in a small way, health policy.
It's a niche and holistic program by design. We impart cutting-edge knowledge and skills in 6 different verticals of healthcare management. This allows our students to be at the top of all aspects of healthcare management, including marketing, sales and distribution, operations, finance, and most importantly, ethical and responsible leadership.
Digitalization is going to be the norm of healthcare. The COVID pandemic has only accelerated the pace of digital transformation. Technology innovations led by big tech companies and startups are driving the adoption of technology not just for the provision of healthcare, but also for B2B transaction between hospitals, big pharmas, laboratories and medical equipment companies, changing the landscape of healthcare sector.
Designing meaningful innovations is a key to success in healthcare. Healthcare sector is the biggest one to witness startup growth, not only in India, but across the world. The future managers need to learn the art of innovation, and we are proud that our curriculum imparts the knowledge on all facets of innovation and encourages the students to innovate with a strong purpose.
Our collaborative research work with and for national and international organizations of repute gives us the opportunity to contribute in some way to building more equitable and efficient health systems and to public health policy. We then bring these learnings into the classroom where we can discuss them and engage with our students.
We believe in experiential learning, hence we take our students to hospitals, pharmaceutical plants, where students work on live projects where they implement all that they learn in class.
The curriculum of HCM program is designed in such a way that it helps students, the future healthcare professionals, to equip themselves not only with core competencies but also soft skills which are essential while dealing with diverse clients from the field. We give practical exposures to students through different innovative technologies of teaching. We do book reviews, we do film reviews, we do panel discussions from various experts from the field so that the students are aware about the current developments of the field nationally and internationally.
One of the mission objectives of the Goa Institute of Management is to create socially sensitive and responsible managers. To this end, we offer a unique service learning program known as the Give Goa Health. The Give Goa Health enables students to work with an NGO for a year and help them solve a range of their managerial problems. Give Goa Health is very special because it makes the students socially sensitive, allows the students to interact with the client, the community, understand their needs and come up with effective and very creative solutions.
We encourage students' mobility across the borders through our international exchange programs. We are in collaboration with some universities in Europe, Southeast Asia and North America and even in Sub-Saharan African countries. So the students will get an opportunity to spend one term in the collaborating universities and they will get the exposure from the experts from that particular universities.
To ensure that students actually learn to manage this VUCA world, most of our courses essentially gets incorporated with simulations, putting them into real life scenarios in which the simulations themselves are tweaked so as to bring about a volatility. Case studies is another interesting pedagogy which I use to ensure the students are able to take decisions in this complex and ambiguous environment. Each of these pedagogies are used specifically in the courses of new product development, marketing management, sales and distribution, and therefore really trying to bring out the best of students and build those leadership skills which our VUCA world really aspires them to have.
As the world is shrinking and the managers are becoming more global, we provide in-depth knowledge of healthcare systems in the leading countries of the world. We also invite thought leaders and experts which interact with our students so that they can learn from the achievers themselves.
This is not Wall Street. This is the Finance Lab at the Goa Institute of Management, or as we call it, GIM. But there's more to GIM to dive into. This is the gym, where students do half of the heavy lifting, not the kind of B school is known for. And this is Jaggu, who students visit to take the load off. He has refreshments, munchies from his well-stocked daily needs store, and a whole lot of chuckles. This is the library for the silence and food for thought. It's open 24/7. And for some food for the belly, this is the mess. It's the opposite of messy. And as much as the food is balanced by a team of 3 master chefs curating Indian and continental cuisines, it'll take you back to your mom's kitchen. And this is where your mom will expect you to spend most of your time. And professors too. Lumbar support? Check. Surround PR system? Check. Disconnect from the outside world? Not so much. This is Aravalam Waterfall, a few minutes away from campus. Connection with nature? Check. This is the special tree. It's just peaceful to be around it. And right around it, here's the prayer room for those midweek blessings, or the ones you might need before placements. But would you? This is Sujaya Rajkhowa, all set for a placement interview. She's not nervous at all. 100% placement record? Check. This is the multi-purpose hall. It can house 4 fighter jets, as much as it can host convocations, badminton tournaments and thought leadership sessions, like the peace session we held with the Dalai Lama. Speaking of peace, this is the view that students wake up to. This is the sky at sunset. And this is the sky at midnight. But there are no bedtimes at GIM. In fact, midnight is when the life of the campus begins to spark. These are a few fun events hosted by many of the student-driven clubs. Clubs that complete the campus life. And for whatever's left incomplete, this is the maintenance team who will help you fix a tap leak and climate change by installing solar power systems. With over 75 professors, 50-acre campus and 6 programs, this is GIM, the B School gem in Goa.
We are GIM, Goa Institute of Management, spread across 50 acres of land
with 5 distinct programs.
We are Inspired, founded by Father Romuald D'Souza, one of India's most recognized contributors to the field of management studies. We echo ethical leadership through our thought leader interactions, pedagogy and affiliations. We are diverse. Everyone is a minority at GIM. Our students come from all walks of life, from all across the country and beyond.
Assam, Andaman Nicobar Islands, West Bengal, Goa, Haryana.
We are a community with over 3,000 influential alumni spread across 15 countries, distinguished faculty and global partner campuses. We are responsible. With our Give Goa initiative, our students work closely with NGOs to develop surrounding communities. We are responsive. GIM engages with business and industry and our society to ensure that our programs meet their needs. Our innovation lab, big data analytics, healthcare management programs and gamification learning are some of the things that ensure that we teach the right thing the right way. We are growing and raising the bar. Our placement committee helps students seize career opportunities that help achieve predetermined goals. We are fun. With varied on-campus activities, we provide holistic, non-classroom learning and community building. We are one with nature. Nestled on a picturesque hillock in Goa, our campus sets the perfect stage for easy and comprehensive development of our students. We are excited for our future and the leaders we make. That's why we are GIM, Goa Institute of Management, School of Next Marking Management Studies.
Welcome to GIM. This 50 acres landscape is the home ground of sustainability. Here we create responsible managers for tomorrow because sustainability runs in the DNA of GIM. So we can proudly say grass is always greener on our side. But how have we achieved this? Solar plant is a major energy source at GIM. Energy consumption is monitored and audited. LED lighting saves energy. The pool transport system reduced both oil consumption and CO2 emissions. GIM hosts a rainwater harvesting pond, an atmospheric water generator, and 2 sewage treatment plants. Bean-wise segregation scheme treats dry and wet waste. The plant species in the campus are documented and published as Floral Biodiversity Register and Coffee Table Book. The faunal diversity within the campus project is in progress. GIM CSD has completed projects funded by Finnish National Agency and German Development Institute. GIM CSD is a part of Sustainability Centers community with 150 other global sustainability centers. The Give Goa initiative upholds sustainability among local communities to student projects. 87 projects have been completed in the 5 years. Sustainability Hackathon is conducted every year to encourage and reward innovative ideas to develop sustainable campuses. The No More Use and Throw campaign by GIM students has already saved 96,000 paper cups. GIM has contributed towards the Green Industries Goa campaign. Sustainability Horizon disseminates the knowledge and practices of sustainability. All our support staffs come from local communities with almost 50% rural women.
This is how.
The grass is always greener on our side.
This is how.
Our responsible managers make it green. On the other side as well.
This is how.
We will be a net zero campus in the near future.
Give Goa is a unique program, and through this program, students are oriented towards the social sensitivity. Students go out in the community and work with underprivileged section of the society. Development of empathy and humility is done through this Give Goa projects.
GiveGoa gives the students of GIM to work on a range of projects which can be in the field of agriculture, in rainwater harvesting, financial inclusion, a lot of health projects students take up as part of their GiveGoa course. Basically what GiveGoa does is to sensitize students about the grand challenges that the society has. It also helps students to enhance a lot of their skill sets and also teaches them to build new skill sets. Now these skill sets could be communication, teamwork, strategy. GiveGoa helps them to innovate, to understand how do they strategize when they are faced with challenges. As they learn in the classroom, they have the opportunity to go out and directly experiment what works when faced with a real life problem. They undergo a sensing journey, they interact with various stakeholders, understand their pain points and then strategize. GiveGoa adopts a design thinking approach, and I think it is a fantastic way of teaching the students how to be responsible leaders in the industry which they would join after the 2-year course.
The healthcare management program at the Goa Institute of Management was started in the year 2013. Over these last 8 years, we've been able to benefit over 500 students. A lot of these students today are employed in some of the best organizations in the country, and many of them now work in various parts of the world. This program has helped shape and benefit the overall healthcare industry in the country. Today we have a large number of our faculty and our students who influence, in a small way, health policy.
It's a niche and holistic program by design. We impart cutting-edge knowledge and skills in 6 different verticals of healthcare management. This allows our students to be at the top of all aspects of healthcare management, including marketing, sales and distribution, operations, finance, and most importantly, ethical and responsible leadership.
Digitalization is going to be the norm of healthcare. The COVID pandemic has only accelerated the pace of digital transformation. Technology innovations led by big tech companies and startups are driving the adoption of technology not just for the provision of healthcare, but also for B2B transaction between hospitals, big pharmas, laboratories and medical equipment companies, changing the landscape of healthcare sector.
Designing meaningful innovations is a key to success in healthcare. Healthcare sector is the biggest one to witness startup growth, not only in India, but across the world. The future managers need to learn the art of innovation, and we are proud that our curriculum imparts the knowledge on all facets of innovation and encourages the students to innovate with a strong purpose.
Our collaborative research work with and for national and international organizations of repute gives us the opportunity to contribute in some way to building more equitable and efficient health systems and to public health policy. We then bring these learnings into the classroom where we can discuss them and engage with our students.
We believe in experiential learning, hence we take our students to hospitals, pharmaceutical plants, where students work on live projects where they implement all that they learn in class.
The curriculum of HCM program is designed in such a way that it helps students, the future healthcare professionals, to equip themselves not only with core competencies but also soft skills which are essential while dealing with diverse clients from the field. We give practical exposures to students through different innovative technologies of teaching. We do book reviews, we do film reviews, we do panel discussions from various experts from the field, so that the students are aware about the current developments of the field nationally and internationally.
One of the mission objectives of the Goa Institute of Management is to create socially sensitive and responsible managers. To this end, we offer a unique service learning program known as the Give Goa Help. The Give Goa Help enables students to work with an NGO for a year and help them solve a range of their managerial problems. Give Goa Help is very special because it makes the students socially sensitive, allows the students to interact with the client, the community, understand their needs and come up with effective and very creative solutions.
We encourage students' mobility across the borders through our international exchange programs. We are in collaboration with some universities in Europe, Southeast Asia, and North America, and even in sub-Saharan African countries. So the students will get an opportunity to spend 1 term in the collaborating universities, and they will get the exposure from the experts from that particular universities.
To ensure that students actually learn to manage this VUCA world, most of our courses essentially gets incorporated with simulations, putting them into real life scenarios in which the simulations themselves are tweaked so as to bring about its volatility. Case studies is another interesting pedagogy which I use to ensure the students are able to take decisions in this complex and ambiguous environment. Each of these pedagogies are used specifically in the courses of new product development, marketing management, sales and distribution, and therefore really trying to bring out the best of students and build those leadership skills which our VUCA world really aspires them to have.
As the world is shrinking and the managers are becoming more global, we provide in-depth knowledge of healthcare systems in the leading countries of the world. We also invite thought leaders and experts which interact with our students so that they can learn from the achievers themselves.
This is not Wall Street. This is the Finance Lab at the Goa Institute of Management, or as we call it, GIM. But there's more to GIM to dive into. This is the gym, where students do half of the heavy lifting, not the kind a B school is known for. And this is Jaggu, who students visit to take the load off. He has refreshments, munchies from his well-stocked daily needs store, and a whole lot of chuckles. This is the library for the silence and food for thought. It's open 24/7. And for some food for the belly, this is the mess. It's the opposite of messy. And as much as the food is balanced by a team of 3 master chefs curating Indian and continental cuisines, it'll take you back to your mom's kitchen. And this is where your mom will expect you to spend most of your time. And professors too. Lumbar support? Check. Surround PR system? Check. Disconnect from the outside world? Not so much. This is Aravalam Waterfall, a few minutes away from campus. Connection with nature? Check. This is the special tree. It's just peaceful to be around it. And right around it, here's the prayer room for those midweek blessings, or the ones you might need before placements. But would you? This is Sujaya Rajkhowa, all set for her placement interview. She's not nervous at all. 100% placement record? Check. This is the multi-purpose hall. It can house 4 fighter jets, as much as it can host convocations, badminton tournaments and thought leadership sessions, like the peace session we held with the Dalai Lama. Speaking of peace, this is the view that students wake up to. This is the sky at sunset. And this is the sky at midnight. But there are no bedtimes at GIM. In fact, midnight is when the life of the campus begins to spark. These are a few fun events hosted by many of the student-driven clubs. Clubs that complete the campus life. And for whatever's left incomplete, this is the maintenance team who will help you fix a tap leak and climate change by installing solar power systems. with over 75 professors, 50-acre campus and 6 programs. This is GIM, the B-School gem in Goa.
The digital metamorphosis in healthcare is a catalyst for new possibilities and opportunities in research and innovation. A host of technologies, particularly artificial intelligence and machine learning, is poised to play a central role in this transformation. These technologies will allow our analysts largely and to diverse amounts of health data, leading to identifying patterns and relationships. The resulting insights will result in accurate patient outcome predictions, redundant medical errors, and improved patient care and better clinical outcomes. The digital transformation permits a prime opportunity for academia and industry to take a prominent position in fundamental research and make advertisements in medicine, drug, diagnostics, devices, and positioning India as a leader of delivery-driven knowledge and economy. The panel too will now deliberate on the topic capabilities of digital metamorphosis in healthcare for research and innovation for knowledge economy. I call upon Dr. Supriya Fadnis to introduce the panel to. Over to you, Professor. I request all the delegates of panel to kindly felicitate the stage. Thank you, everyone.
Ladies and gentlemen, it is my pleasure to introduce the first member of panel 2 today, Dr. Ambuj Chaturvedi. A clinician by training, Dr. Ambuj has extensive hands-on experience in multiple specialities such as general, oncosurgery, neurosurgery. After 7 years of clinical stint, Dr. Ambuj pursued postgraduate management education from our very own Goa Institute of Management, gold medalist, and spent next decade with medtech industry. Dr. Ambuj has held diverse leadership roles at Johnson & Johnson Medical India, Medtronic India, and IKP Knowledge Park, where he led 3 verticals, including a VC fund to mentor and provide bridge funding for commercial-ready startups operating in the digital healthcare space. Currently, he serves as a Director of Professional Education and member ISC Management Committee at JJMI. Thank you for being here, Dr. Ambuj. Our next panelist is Dr. Devlin JG. Dr. JG is a highly accomplished physician and business strategist with over 12 years of experience. Dr. JG has worked as a strategy lead at KPMG and has been associated with several healthcare technology consumer health providers in South Asia as a product and business head. Currently, she leads Google Health for India and oversees health projects in YouTube, Google Search, and AI research in health. Dr. JG's passion lies in collaborating with healthcare innovators focused on creating optimal product solutions that addresses gap in the user's healthcare journey. Thank you, Dr. JG, for joining the panel today. Now, it is my pleasure to introduce our next panelist, Professor Ganesh Ramakrishnan. He is an esteemed Institute Chair Professor at the Department of Computer Science and Engineering, IIT Bombay. Professor Ramakrishnan's research expertise include human-assisted AI/ML in research constrained environments, and learning with symbolic encoding of domain knowledge in ML and LLP, amongst others. He has received several prestigious awards, including the IBM Faculty Award, awards from Qualcomm, Microsoft, and IIT Bombay Impactful Research Award, to name a few. Recently, he received a national award for e-governance for his outstanding research on citizen-centric services by Academic Research Institution. Professor Ramakrishnan's passion for boosting the AI research ecosystem in India has led to the creation of several startups, and he is also serving as a professor in charge of the Quetta Center for Digital Health at IIT Bombay. Thank you, Professor, for joining us today. I'm happy to introduce Dr. Omain John, a renowned physician and a public health researcher with expertise in health informatics. Dr. John is an elected fellow of the International Academy of Health Science Informatics and holds an executive MBA from the Indian Institute of Management, Calcutta. He currently leads the health system designs at BMGF, India Country Office, and is the focal point for technical support to National Health Authority for PMJ. Dr. John has extensive experience in designing and implementing and evaluating innovative solutions in health service delivery. He has also served with World Health Organization in immunization strengthening and vaccine delivery, research and development at Country Office India and Southeast Asia Regional Office. He is a member of Scientific Advisory Committee at Foundation of Innovation Diagnostics, Commonwealth Center for Digital Health, WHO Digital Health Guidelines for Guidelines Development Group, and ITU WHO Focus Group on Artificial Intelligence for Health. Thank you, Doctor, for joining us today. It is my pleasure to again introduce to you Professor Sanjay Bihari, the Director of Sri Chitra Tirunal Institute for Medical Sciences and Technology, Kerala. He is a former professor and head of the Department of Neurosurgery at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. Professor Bihari is a highly accomplished academician with numerous accomplishments to his name. He has applied for 7 patents and has 367 PubMed indexed publications and 142 chapters and books. Additionally, he has guided several senior residents, doctors, doctoral and MD students. He has been a visiting professor to several institutions from different countries such as Japan, Switzerland, USA, and Portugal, to name a few. He has received numerous awards, including S.R. Naik Best Researcher Award, the S.S. Agarwal Award for the Best Published Research Work of the Year in the Institute, and the James Dyson National Award for Best Biomedical Invention in 2017. Thank you, sir, for joining this panel today. It is my pleasure to introduce to you our moderator for the session, Professor Ajay Vamadevan. He is Professor and Program Chair of the Healthcare Management Program here at GIM. He holds a doctoral degree from University of London for developing a digital health intervention for hypertension and diabetes management in primary care. As a member of a leading transnational research collaboration, he had grant awards from prestigious funding bodies such as Medical Research Council, National Institute of Health, Wellcome Trust. Ajay has over 20 years of experience and has published over 60 scholarly papers and 10 chapters, books, reports with an H index of 30. He was also an Emerging Leader Fellow of the World Heart Federation and a Public Health Leader Fellow of the PHFI Emory University Consortium. His passion is translation research, particularly in developing clinical decision support systems for managing chronic conditions in primary care. Thank you, Ajay, for agreeing to moderate this session, and I hand over the mic to you. Thank you.
Thank you, Professor Supriya, for your kind introduction. Before initiating the panel, I will give you the structure which we are going to follow. I will give you an overview of the topic on which the panel is going to have the deliberation. Subsequently, I will invite all the panelists for an introductory remark. Subsequently, we will ask questions and then followed by discussion. So I'll try to wind up in an hour because we have time constraints. So going to the panel specific. Ladies and gentlemen, I welcome to you this highly anticipated panel on capitalizing on digital metamorphosis in healthcare for research and innovations for a knowledge economy. We heard from the previous panel the response of the industry to this digital metamorphosis. So today we have gathered a group of experts who are at the intersection of healthcare and technology to get their valuable insights on how the digital transformation in healthcare can be harnessed to propel research, drive innovation, and pave way for a thriving knowledge-based economy. As you all are aware, the Ayushman Bharat digital mission is establishing the required backbone for to support the integrated digital health infrastructure in this country. And this the new paradigm or the the digital transformation is going to give rise to, is going to change and will change the way we deliver healthcare, from the way we diagnose and treat diseases and the way we manage our health. The convergence of the advanced technologies like artificial intelligence, machine learning, blockchain, Internet of Technologies have opened up new areas, avenues for enhancing healthcare delivery, research and innovation. For example, big data analytics, artificial intelligence and AML enables us to extract insights from vast amount of patient data, leading to improved diagnosis, disease prevention strategies, and even precision medicine approaches. Telemedicine, sensor technologies, and remote patient monitoring systems are transforming the healthcare delivery, ensuring access to healthcare even to remote locations. Virtual reality, AR, VR, simulation technologies are providing immense opportunities for training of the healthcare professionals, fostering a culture of continuous learning, skill enhancements. Thus, the digital revolution is promising improved patient outcomes, enhanced efficiency, cost saving, and a wealth of data-driven insights that can fuel further advancements. We, Indians with a 1.4 billion population, is at the right moment to capitalize on the digital transformation to become a knowledge-based economy. In a knowledge-based economy, intellectual capital, innovation, and application of information technology becomes the critical drivers for growth and success. Healthcare being information-intense industry stands to gain immensely from this opportunity. Countries which have the ability and who can capitalize on this digital transformation and leverage data-driven insights will be ahead in breakthroughs in research, innovation, treatment methodologies, and protecting the health of their populations. Further, for India, there are specific reasons to capitalize the digital transformation. I can list some of them. Major point is that our population is very, very diverse. We are very diverse in terms of our culture, dietary habit, geographies in which we live. We all know that environment play a significant role in influencing gene expression. It has been observed wide variation across the Indian population group, variations in the effectiveness of even those drugs that are there in the market across different population due to this complex interplay of gene environmental factors. It is also a fact that common drugs have not been adequately tested in the Indian population. Therefore, such diversity warrants more clinical research in the Indian population. We also need to develop precision medicine and personalized health approaches to tailor specifically for the Indian population. Second factor is the rapidly aging population, particularly in the urban areas, who have newer healthcare demands, alternative methods of care delivery that are needed to suit their unique needs, such as home-based care and assisted living facilities. Third factor is that we have among the younger age group, there is increasing awareness and demand for wellness and preventive care services. We are also, lastly, finding many emerging diseases such as Ebola, Zika virus, TB are global concerns, and anytime the next pandemic can happen. So we need better forecasting and modeling capabilities to address such emerging challenges. So to address these healthcare challenges and healthcare demands, we require to invest in drug discovery, advancements in diagnostics, development of sensor technologies and point-of-care devices, and alternative care delivery models. To complement such discoveries, efficient academia industry partnerships are required
to expedite market assessment, funding, regulatory compliance, manufacturing, distribution, and so on, so that ultimately we can lead to a successful introduction of technology-based solutions in the market. To fully capitalize on these opportunities, academia-industry partnership is not alone sufficient. We need to prepare, we build our capacity of the academia, industry, healthcare providers, including the practitioners, to harness the potential offered by these advancements. We also need to establish robust systems, including policies that facilitate, regulate the generation of high quality data sharing practices between academia and industry. Besides that, we also need to address privacy and security concerns, ensuring interoperability of the systems. Moreover, in the panel also alluded to, the earlier panel, maintaining a focus on ethical practices and ensuring equitable access to healthcare is imperative. It is vital to ensure that digital innovation do not exacerbate the existing disparities in health, and everyone has fair and equal access to benefits they offer. So with this background, let's start the panel, and the outcome of the panel we are expecting is how we can, step by step, establish a partnership between academia and industry to leverage the digital transformation in healthcare for advancing research and innovation. So before getting into the discussion, I would request each of the panelists have a brief introductory talk about the topic and what they do. So, Dr. Divli.
Sure. Thank you. Good afternoon, everyone. I hope everyone's awake post-lunch. It was very good food, by the way. Thank you so much. So I think what we are talking about today is it's a very relevant topic, and I just have a couple of points to make as opening remarks. The first is I think it's important for students to be encouraged to read more and to be interested in research. There is maybe in India those opportunities might not exist today, but I think the path forward with all of the things that Professor Ajay just mentioned, there is no way that we will be able to implement any of the things that we have been talking about till we have real world data or real world research come from actual Indian populations. So I think the first point that I'd like to make is the understanding that research as a career is a possibility. And it is important. There are enough and more initiatives that today exist. I was very pleasantly surprised by how many research papers have come out of the Goa Institute of Management. But I think it's important to be considerate and to be aware of that. That's number one. Number two, I think it's also important to start to think of, all of us keep talking about precision medicine, personalized care, which are beautiful buzzwords, I like to call them. But there is a lot that goes into making medicine precise. And no one today globally has been able to actually deploy precision medicine tools at scale. But there has to be a reason behind it, right? So again, I urge you all to read about it, but I'll leave you with this, this thought, right? There is data, they say, is the new oil. For folks who've not heard this, please go Google it. Data is the new oil. The problem with data is that a lot of it is unusable. So what do you do to make data usable? It's a very big piece which tech companies have been talking about for years and years. But today it's become dinner table conversation, largely because I think that data in a structured manner, which has the right kind of labels that can further be used for research, coding, inferences, analytics, whatever that might be, is possibly the next big thing that will happen for all of us to then use AI tools in our day-to-day life. And when I say AI tools in our day-to-day life, I'm not talking of Gmail. I'm talking of the applications of AI in health. So my vision, where it stands today as I sit here, maybe in the next 10 years, hopefully in the next 5 years, it should be that when a baby is born to a set of parents, the parents should be made aware that they need to do X, Y, Z for their child to achieve their developmental milestones in such and such time. Or, you know, something to the tune of, your child is at risk of ABC diseases because of your genetics and because of your lifestyle. We hope that you invest in your child in a certain way so that he or she lives the most optimal life. I know this is possibly leaving you with too many thoughts, but that's what I would like to open with. Thank you.
Okay, I'll go next. First of all, it's a pleasure to actually always come back to your alma mater. And I thank Sir and thank the entire organizing committee for inviting me to this campus. Although I would still, the disclaimer is I still miss the Raibandar campus more. So that way you can call me old school. But yeah, because ours was the last batch that actually graduated from that place. But this is an awesome campus, and I was sharing with Sir, every time I come here, it just keeps getting better. With that, I would go with what you said. You know, you said data is the new oil. It is the new oil, but to add to that, you earn markups when you start building refined products from oil, you know, derived products. And so therefore, when you have data, a lot of the value that you add to data is when you start curating it, refining it, enriching it, putting in analytics into place, and then start developing interpretations and putting in action items in place, getting outcomes, actionable outcomes. My thoughts on the initial issue. So there are two words here. There were three actually, but metamorphosis was already explained pretty much by panel one. So the other two terms, which is research and innovation and knowledge economy. So when I started thinking about this topic, and I was talking to a diverse set of stakeholders across my networks in the industry, two things came out. One is, research and innovation has to be relevant for this community, and now for this market. And so therefore, the comment made by the moderator, Professor Ajay, that there's a lot of diversity within Indian populations. Is it faithfully represented in the overall clinical literature out there? The answer is no. Some people call it the North-South divide, wherein they say the entire processes and technical talent, competence comes from the North with the developed economies, and yet the data lies here. However, are we trained enough, or do we have the capabilities to analyze that data and come up with actionable items? Currently, the answer is no, that's the gap. So there is if you look at research and innovation as a product, there is a production consumption gap. So therefore, an example of that would be the plasma and serum ranges of the biochemical indicators that you have today are heavily driven by processes which are written out there. And does it faithfully represent the Indian population? At least the clinical community says no, as of now. The second piece is knowledge economy. And so therefore, when we want to look at the topic today, we not only want to look at how capabilities are being developed, the supply side, but you also want to look at how they can be productized and monetized, the demand side. And so therefore, the larger conversation, therefore, at least from my side, would be trying to look at capability building from a supply side on one side and on the demand side on the other. With those opening remarks, I'll pass on to my next panelist.
So thank you. It's an honor and privilege for me to be here. Rather than repeating the thoughts of others, I thought I'll tell you about the regulatory problems because of which medicine still lags in the digital revolution. And I'd like to focus on the word metamorphosis again. So first of all, we have in the government a Make in India policy, which means that no product can be bought by any institution if it is not made in India, if 25 to 50% of the product is not in India, which means that this year there are about 300 medical products, high-ended, which have got exemption. But I'm not sure if that exemption will persist till 2024. So every multinational company has to actually have 25 to 50% of the product which has to be made in India. The second very important thing is that copyright issues have come in a long way. So what has happened is that copyright laws are here to stay. And you now cannot copy and, we economize on the already existing equipment. We just, it's known as reverse engineering, by which we break down the equipment and then kind of modify it to our settings and make it cheaper. That has to go, because the copyright laws which are coming up in India are coming in a big way, and this is a part of the global network of copyright laws. The third very important thing is the medical records, related to medical records. There are three big issues related to medical records. First of all, in the judicial parlance, if you have a consumer forum case against a doctor, then electronic laws are not permitted. So every doctor has to keep actual, day-to-day records cannot be digitalized. They have to be, because you can always reconstruct retrospectively the laws, those records. So therefore, in the judicial setup, you cannot have those. The second important thing is confidentiality. Even publication of papers now, if that image can be identified and you have not taken permission from the patient, it is regarded as a confidentiality breach. So therefore, you have to be very, very careful. You have to take prior permissions, and that permission has to be for the specific paper and for the specific journal. So that's a very, very important thing. Then there is another very important point is, of course, hacking. This AIMS thing came up, and every institution is really, really terrified by this. And for example, I control a huge amount of budget of the central government, and which means that I cannot keep any other electronic transaction system, because the income tax, all things are actually linked to the institution codes. So if my account is hacked, then it becomes a big issue for me. So that is a big problem, and it happens in AIMS also, which became a big problem. Then there is another very important point which nobody talks about, and that of course is not related to security, but what happens when the contract of that agency stops, the computer agency stops. Then the problem is they suddenly walk away, and this has happened in SGPGI. So now there's a huge amount of data. They have just walked away. You're not giving us more money, and it's an exorbitant amount of money which is taken after 10 years. And if they suddenly walk away, your entire data collapses, because the data is managed by them. They have passwords which we cannot actually go through. And the other thing is the entire finance collapses. You have to do it all physically. And the patient follow-up collapses because you can't do anything. It becomes a big issue. So now I think whenever we are negotiating, when you are hospital manager somewhere, you have to negotiate in such a way that in case that contract actually goes down, that what you need to do is to ensure that the company will still maintain the data till it is translated to another company who takes it up in the next tender. That's a very important point. The fourth point is, there's a point known as valley of death. So what happens is that whenever you are making a digital device, so up to TRL level 4 or something, you are making it in an institution. But as soon as you go beyond that, the regulatory laws of India actually have mandated that you have to collaborate with a company, and that company will take your product and then collaborate with you to test it further. You understand? So therefore, it's not like you can just go away and do something and then translate it to the market. These are laws which have come up, and this law has come up only a month ago. So what happened was that the Drug Authority of India, and which is the CDSCO, and the biomedical device development had the common laws. But it became an issue because whenever a drug was made, the same laws were applicable to biomedical technology laws. So only about a month ago, the Parliament has enacted the biomedical technology laws, which are separate from the drug development laws. And therefore, according to that, beyond a TRL 4, it is mandatory for every company to collaborate with you. That's a very important point that needs to become. Then the other very important thing is telemedicine versus physical collaboration. There's a big issue there. In the court of law, if you have actually given medicine on WhatsApp, or you have given a medical consultation of WhatsApp, and something happens to the patient, then actually the doctor is held culpable for it. And this has happened in Bombay. There's a court case, and there's a doctor couple who is on culpable homicide not amounting to murder. So that's the issue which is going on in Bombay. So that is why you have to actually have a physical one. It's not like you can just go and do, these are some of the regulatory laws which have come up. Then there is a very important thing which has come up, which I think every pharmaceutical company should know, and that is the treasury single account. What happens is, any money comes into the government, And on 31st of March at 12 midnight, the entire money goes. So on the 1st of April the next year, you are left with zero account. So now what you have to do is, you have to plan the whole year and give the order at the beginning of the year, because what happens is when you are actually installing a machine in a hospital, this machine can only be, the money can only be paid when the machine is installed. And the permission for that money is given only for that academic year. It cannot go to the next year. So therefore you have to plan your entire thing in such a way that you plan the whole year and give the order in April, so that you have the whole year for installation and for making the turnkey project. I mean, this is something which most people don't know about. Then the second thing is a very important thing, which is the benevolent fund, where digital technology really comes in. What happens is the benevolent funds have a certain cap on them, and the actual expense of every institution is more than what is in that benevolent fund. So there is a continuous deficit which is going on, which is actually absorbed by the grant in aid of the institution. But then there are some state government funds also which are also coming in, state government benevolent schemes which are coming in, and they are not sponsored by the central government. And so this deficit goes on increasing, and therefore that fiscal balance has to be maintained, where the budgetary requirements that you have cannot exceed what is actually given there. So that's a very important point for which, as hospital managers, you need to come in. Sorry, shall I go on? Just one thing. And then, of course, then the other important thing is, when we are talking about the integration. So what happens is, if everything is integrated, you have an e-office completely, then the problem is, as soon as one contract stops, then the entire thing has to be integrated. Like, for example, if Google or Microsoft suddenly changes its, your generation, right? Suddenly the operating, then suddenly the whole thing collapses, because nothing is updated. The securities are not updated, and everything becomes a problem. And then, this can easily be hacked by the systems. So these are some regulatory problems, which, of course, there are more, but I think these are some major problems which confront the industry. And I think as future managers, I think you need to also focus on these important issues. Thank you.
Thank you. I thoroughly enjoyed the morning session, and my take home from that, and specifically a nice summary from Dr. Anjan Bose, is that we really need to think with the end in mind, or possibly an imagined end in mind. I think you said the frontiers of imagination will also keep expanding, but it's important to start thinking with the end in mind, and I think the Ayushman Bharat Digital Mission was an excellent step in that direction. Leapfrogging, some of the issues with the legacy, frameworks that exist in the West, and I hope it's as successful as what UPI has been. So I think there have been other initiatives like the National Disease Modeling Consortium, and thankfully IIT Bombay, our Quetta Center for Digital Health, we are an anchor for that. I think we need to create such large initiatives where we have left hand talking to the right hand, industry talking to the academia and the government by design. The other important take home for me, and building upon the data part, is the data stories, right? It's not just data. What happens to the data? What is the life cycle of data? So that also ties back to the Ayushman Bharat Digital Mission, where, for example, the custodian of the data is the end user, the patient, right? But then what you do with the data, how do you make efficient use of the data, are still very interesting problems we can work upon. So this is an appeal to the students. We also need to have our feet on the ground, because that's when you understand how challenging the annotation process is, how much is the redundancy across different lateral departments. So it's important to engage with hospitals, with healthcare partners, with industries. And again, at the Quetta Center for Digital Health, which I'm heading, we've been trying to do that. So yeah, these are my some reflections on the discussion so far. I'll try to keep it short.
Thank you for this opportunity. It's been a pleasure to be here. Just want to go back to some first principles. So when we're talking about metamorphosis, we've metamorphed from a information technology into a digital thing. But the crux of the information technology part was the information. We've somehow traded technology over information. And what we saw in COVID is a typical example. There was a demand, surge in demand, okay? But there was no information available either to the decision makers, the people who were funding it, or to the end user. Where is a bed? Where is a doctor? Where is a medicine? Where is an oxygen tank? Where is a ventilator? Have we solved for it post-COVID era? Not yet. So if we were to go to some of the first principles, okay, all of digital what we talk about is about making sure that the information needed for decision making is available to every person who has to make a decision. Here again, on the flip side is that if you give too much information, there is information overload, and therefore you can't make sensible decision. Obama used to say, I only wear a single color shirt because I want to preserve my cognitive capacity to make better decisions for my country. So like that, for a doctor, even for a patient, so today we have so many platforms that are saying, giving SMSs after SMSs, saying your value is this, now you should take this supplement and you should do this and that. And we earlier heard Om telling about some messages are useful, a lot of them are probably not useful. So that whole user experience of what information is going to be useful for every person who's going to use that information to make a decision is again an important aspect. So we still haven't figured out the user experience in healthcare, and our healthcare systems as it delivers health today are from the 40s and 50s. Okay? Today we have people who can move from point A to point B in a fraction of a second by making a decision on how they are going to do that. You can sit at home and have instant gratification of having the best food in your town coming to you. And we have asked these people to be patient. Okay? They are patient, impatient patients. So we have to use information to help them to make better decisions, have better capability of managing their own lives. So this is what I would think digital health metamorphosis is all about.
Thank you, panelists, for the very informative introductory remarks. Now, specific questions to all of you, and the toughest question will go to the IIT guy. So to you, Dr. Ramakrishnan, what are the potentials of Ayushman Bharat in generating real-world evidence for accelerating research discoveries and improving patient outcomes? And the follow-up question is going to be, what are the challenges and potential solutions to access high-quality data for prospective research?
Thank you. Thank you for waking me up with tough questions. I'll again highlight a very interesting take-home which I had from the first session, which is having the end in mind and feet on ground, right? So Ayushman Bharat Digital Mission, therefore, I find it's really nice because it actually provisions for where India could go. Now, my personal experience with Ayushman Bharat, we helped roll out the training program in the beginning, as you can see in those slides. I've used slides since pictures speak 1,000 words. I can speak briefly, right? After that, we continued our engagement with Ayushman Bharat, the hand-holding of bureaucrats, and also the frontline workers through the Koita Foundation, which actually also funded our center. So our experience with data, I talked about the data story, right? Data story as it might unfold, as it unfolds even today in the Ayushman Bharat Digital Mission. You have data of omics nature, you have data that comes from patients, individual, and you can see with the individual patient could be multiple modalities, it could be PET CT scans, it could be from histopathological reports, and obviously a lot of the customary old school data, which could be several biomarkers. And then, of course, you have the third, which is the population level data. Now, it's important to know that the three cannot operate in silos beyond a particular point. So you need to make sure that they integrate. And I think the sandbox environment that Ayushman Bharat Digital Mission provides does help for integration of all of these, even through private partners. I'll give 2 or 3 examples. For example, if you want to do high fidelity extraction from data which is scanned, right? Scanned reports through optical character recognition. Now, doing full-fledged optical character recognition is unnecessary. And this is our experience interacting with National Health Authority, right? All you need basically is some key value pairs. And we found that we can do excellent work through paradigms such as data programming. In case you've heard of a big startup from Stanford called Snorkel, made a lot of money just by writing simple programs. It's not just about employing an army of annotators to annotate data, but writing simple programs that can operate in conjunction with so-called deep learning models. And that's exactly what we've been able to do. We've been able to do that, as you can see, for scanned reports. We've been able to do that for conversations. We work closely with Care India, who are also funded by Bill and Melinda Gates Foundation, on Bihar data. So lots of data, and Maithili, for example. You can do high fidelity extraction, aligning conversations with questionnaires, for example, to reduce the drudgery of extraction. I think that point was also brought up in the panel, the first panel. We need to ensure that data is cleaned and entered in a principled manner for ingestion by design. So that kind of aligns with the important point. And we also have worked with several health partners on using data efficient learning. As I pointed out, we have to reduce the process of drudgery. How do you ensure that the radiologist's expertise is actually brought to fore in the form of rules, in the form of domain knowledge, which can override, I repeat, which can override the deep learning biases, right? Otherwise, you'll have biases all the time and you'll never be able to find the needle in a haystack, which a lot of healthcare is about. Alluding to your point, sir, about working closely with industry, we had very good experience doing this on video surveillance analytics using data efficient learning. In fact, the National E-Governance Award we won was because we had TRL level 4 at academia, TRL level 7 in conjunction with the industry, and then the industry said, forget IITB, we'll take it to TRL level 9. Right? That worked out very well. And I think we should do the same thing here, but create a lot of open source. We have created lots of open source repositories. There's an example called Decile, Data Efficient Learning, which aligns well with the Ayushman Bharat Digital Mission. And it's been put to very interesting applications, whether it's counting the number of cells, whether it is actually making sense of PET CT scans. I've just given some examples here. Yeah. And I think I'll end here.
Thank you, Professor Ramakrishnan. So from academia, then my next question is going to be the industry giant. What are the responses from the industry, specifically the hospitals and insurance industry, to capitalize the opportunity in digital health research and with examples from Google? Can you elaborate on that, please?
Sure. So I think the piece that we all need to understand and realize is that we're still at the end of it doing business. And business means, where does the money come from? And who is it that's bringing in those dollars? For a hospital, it will be the number of doctors that they have, the ones that draw the maximum footfall, because ultimately the patient will pay to get better. For an insurance company, it'll be the number of people that they can sell their insurance policies to. For them, a lot of the data that they have today is largely because it was mandated by a regulation that came about 15 or 10 years ago. All of the regulations that Professor just mentioned are very new. And they are, very honestly, post-COVID coming in retrospective. They have not been put in place in a prospective manner. So in our experience of trying to work with healthcare partners across the board, not just India, is that the data that they have today, it's not that they are averse to digitization, definitely not. They're always open to listening to anything that we might bring to the table. But the problem is that their data has been stored because it was mandated by someone who was sitting in an Oval Office and made a policy without ever even thinking what the future of data could be. So very honestly, all of that to us at this point is what was already mentioned. It is just information without it making sense to anyone. And it increases the drudgery, as we've already discussed. And add to that, there is very hazy policies. every day, every month, in the last, I would say, year or so, there have been newer nuances that have been coming up when it comes to policy. So the piece that I would urge this forum, because there are some very promising minds here and some very highly influential people, is that this is probably the right time to bring up a policy conversation in the right corridors. It's important for healthcare data policy, or even for that matter, healthcare policy, to have representation from industry across the board. It should not just be the government by lanes, it has to be industry leadership, it has to be technology guys, because ultimately, as was earlier mentioned, it's all about collaboration. No one organization can stand up today and say, we are the leaders in XYZ. So, like I said, personally, in our experience of trying to do this, it's been very, very difficult to work across India, because there's so many rules and policies and regulations and compliance issues. We don't have we want to bring this to the world. We want to bring this to India. We want to create an impact, and we are willing to make it, we're willing to give it free of cost. But how do you give it free of cost where you've not tested it? There's a very massive risk, as was also discussed previously. So I think number one, policy around a policy framework which actually lists out regulations as well as compliance frameworks around data sharing, data collection, anonymization, research guidelines is very, very important and essential. That's one. The second, I think, is that it's important to have a basic level of digital infrastructure in place, which is, number one, it's not uniform today. In fact, all large private healthcare players today, across hospitals, across the same hospital and across hospitals, will have different versions of the same software. The Department of Endocrinology will be running on version 1, the Department of Surgery will be running on version 71. And no one, they are aware. So how does data get transferred? It gets transferred in a pen drive. Which is, I mean, I know it sounds very funny while we are sitting here, but imagine this, right? You have a GDA, right? Someone who's not a medical professional carrying medical records in the pocket of their scrubs. Anything can happen, really. And we're talking of the data breach at AIIMS being such a massive piece. I would say that all of it, it's a good time. I'm so happy that it happened. Not in a good way, but in a very bad way, because it now makes people sit up and start talking about things which are very essential. My third, is, when it comes to rolling out tenders for requirements, again, people who need to be sitting and taking decisions do not have the vision of what this data can do. Which brings me to the point, I think I'd like to conclude by saying that digitization is not a technology problem. It is also not an information problem. It's a lack of expertise problem. The experts need to collaborate better. When a hospital is, or even for that matter a ministry is taking a decision, there need to be physicians on the board. There need to be technicians who are going to be using your technology on the board. There have to be tech guys on the board. As was earlier mentioned, right, which I think Sir had mentioned in the morning, you put an engineer in an OT for a month and you see what he does to that OT. Fun fact, Google did it. We put our engineers in Israeli OTs. And the kind of work that has happened within 7 days of observerships is stunning. We now have AI models that work on gastro procedures, which are actually deployed in Israel, largely because the regulatory system there allows us to do it. Nowhere else in the world is it allowed. So, sorry if I took too much time.
So, one more follow-up question.
Yes, please.
So tech giants, how do you address the problem of accessing good quality data?
Yeah. So what we have tried to do, and I think this is the same piece for Amazon, Microsoft, and any tech giant for that matter that's working in data at this point, there have been situations where we have completely given up. We're like, we cannot do this. This is too much money, too many resources, too little results. It will not work. But what we have also tried to do, on the other hand, is start to put these building blocks in place. Because we're global in nature, we today have very large partners who have worked with us to revamp their entire data management practice. And I don't want to call it a system because ultimately it becomes a practice which gets worked upon day in and day out. We also, and these are very large players, you know, the likes of global players. But the problem when it comes to India is that the players that have the kind of data that would make sense to a Google or a Microsoft or an Amazon are ultimately those 3 or 4. There's no one else today that can stand up and say, this is the data, we are willing to anonymize it and give it to you. Or, you know, even for that matter, there are governments today. For example, the Singapore government has an open source data stack. Singapore has it, Japan has it, the UK has a full biobank of data that they give to developers to use and to build stuff on. We need to start to, again, I urge everyone sitting in this room who has access to those corridors of power to maybe position this as a POC that could be done across, say, 1 state, 2 states, or whichever states are actually okay to do this. Because I'll be honest, I have been the biggest supporter of ABDM as a concept. But to everyone that's sitting in this room, how many of you have actually seen one application that was built from the ABDM sandbox and deployed in a real world clinical scenario? Amazing. Because we have been trying to work with the ABDM for a while, and it's been, the scale that was expected has not been reached even as per them.
Yeah. Thank you, Dr. Divleen. Taking a cue from your question, we are finding that there is a dire need for building capacity among a range of healthcare providers and support staff. So the question to you, Dr. Ambuj, how can we address this gap in capacity?
Yeah, so I alluded to that in the initial introductory note, but then I'll go back to this AIMS thing because apparently there are 3 different speakers who have spoken about it. So, fun fact, I was on the team that basically was resolving this issue. We were given 36 hours, and the team was a conglomerate between Microsoft and a host of people from NDHM. And you know what the reason was? Of the 10,000, around roughly about 10,000 devices at AIMS, 90% had pirated or outdated versions of Microsoft OS. And it was something waiting to be happened. So when you said, you know, I wanted this to happen, you know what, Microsoft also wanted this to happen. I said that's the only way for us to convince. And this entire, the accountability for this fell on the NIC. And they had their, so at the end of the day, we hope it's a lesson well learned. Yeah, because there was a lot of talk on AIMS, I thought maybe I'll just put this on the table. So that's one thing. Now coming back to the capacity building. So as I said earlier, there are 2 aspects of capacity. But what is capacity building? You're basically building the entire set of competencies, you know, capabilities within your system so that you can do better research. There are 2 components. There's a supply side, a demand side. Within supply side, there are 3 components. So you have infrastructure, you have processes, and then you have people. So in a supply side, for digital healthcare, on the supply side, from the infrastructure side, there are again 2 parts, devices and platforms. There is a host of devices, there's an entire ecosystem of devices being built right now in the country, which are affecting this. So data acquisition is the function that they facilitate. Platforms, on the other hand, do the rest, which is that once you have the data, then you start curating it, you start structuring it, you train it, you then do an analysis, interpret, put it into actionable items. The current scenario in the country is that you do have a good set of devices coming in. From a platform standpoint, there are issues. Why are there issues? You know, if you analyze this deep within the system, it's because somewhere our education system, or you know, there are multiple cultural factors as well. There is a lack of systems thinking within the education, and then again, there are institutions which are able to do that better, but then again, there's always room for improvement. And because there is a lack of systems thinking, the moment we start talking of integrating, like you said, right, well, the different versions in a hospital, that's the same problem. So in spite of having a platforms /S, you still have to use, you know, third world or you know, 20 years back technologies, a pen drive, and then start putting it in. So that's one thing, systems, lack of systems thinking. That's from an infra standpoint. Process standpoint, there's a big focus on ethics and privacy, and I think a lot of that has been covered by panel 1. So I won't get into details about it. Suffice it to say that, yes, there is a big chunk of work being done around the entire policy piece. The med devices policy was actually launched last month. And while that is the first step, subsequently we will have policies around SAMD, you know, software as a medical device. One thing that came out was, you know, do we have a, can we all come together? Well, yes, we have. So in part, that activity has taken place, you know, about 4 or 5 months back in Delhi. So the initial digital health coalition, you know, National Digital Health Coalition is currently, and it's being driven by a couple of folks like Dr. Ashwin Nayak, Vatsalya, if you see, and then there is Dr. Rajendra Gupta from the PM side, from the PMO side, and a host of industry partners coming in. So it's a growing organization, and I'm sure there'll be a lot more coalition, you know, coalition-based work happening within the digital health space. From a people standpoint, there are a couple of issues. So first thing is, you know, research capability within the, I think the first thing where we lack is a translational piece, which is that, you know, if you have a research versus policy versus practice, there's a big gap. So a lot of the research work, and what I saw today was awesome. The research work that has been happening out here at GIM, I was pleasantly surprised, happy about it. Because the research work that we do has to have a translational impact. It has to have an outcome out there in the real world. That's one, and there are gaps there. Second piece is interdisciplinary. And again, go back to, you know, when you talk about immersion. So when you said, you know, Google engineers did it at Israel, you know, my previous company, Medtronic engineers did it in Banswara, Rajasthan. They came up and they said, you know, sir, we want to build a CPAP. So you want to go there? I said, okay, go ahead. Go to tier 3 towns and then understand how it is. And, you know, they came back and they said, they don't need a CPAP. In a tier 3 town like Banswara, you know, and even in, you know, decrepit conditions, they have AC, NICUs with the latest of ventilators. The problem is not the ventilator or the CPAP. Problem is the nurses are not trained. So they went in, did an immersion, came out, they said, the problem statement hi badal gaya. And now the only thing that they wanted to do was to build a nurses training program, which it did in a vernacular language. So yes, I do agree. So that interdisciplinary piece, which is engineers combining with doctors, you know, it's amazing. You know, so that is where the next part. And the third part is curriculum. The entire curriculum has to be revamped. So a big chunk of what I used to see in my previous profile in innovation was a lot of researchers focus more on publications than on patents. It's changing, but there needs to be a bigger change on it. So that's one piece. Postgrad side, you know, there is a lot of stuff being done. So Indian Institute of Science is now coming up with a medical college where the base degree is not MBBS, it is MD PhD. So those are the kind of you know, innovations that we need to do in the capability system. On the demand side, I can talk about what industry needs to do, which is in terms of putting in, you know, getting in research and putting sponsored research, which is again what I see here at GIM. From a provider side, they do need to build care pathways, and from an academia side, there needs to be a strong tech transfer office, because the moment you start putting in a research and there's a tech transfer capability that you have, you're able to convert it into actionable items and therefore monetize it. So I'll stop at that, but those would be key points on my side.
Thank you, Dr. Ambuj. My next question to you, Professor. So you are heading the Sri Chitra Institute, which has got a public health research unit, a hospital, and a biomedical technology wing, which where innovation happen. So you must be also be a part of the several DST committees. So the question to you is, because you sit on both sides, how to promote interdisciplinary collaborations between diverse groups, industry, researchers, and get help from the research funding bodies to innovate and drive innovations in healthcare.
Thank you so much. So this is divided into two questions. What are the methods, and the second is what are the funding agencies? So let me focus on both of them. First of all, I would like the industry to help in staged modernization of health infrastructure of hospitals. It is impossible for us to pay as a one-time grant. So one important thing is a stage modernization based on your plan. So every year or every 2 years, you decide, okay, this is what we're going to update, and update it. So that we need that. And then it has to be all connected. Then of course the interdisciplinary entrepreneurship refers to not only the cooperation between departments, but also cooperation between the academia, the startup companies, and the industry. They come into the hospital and work. One major limitation with every doctor has is that a doctor cannot be on the board of a startup company. A doctor cannot get money from any industry. Whereas any engineer in my own organization, an engineer can be on the board, and a scientist can be on the board on a biotech company or any biomedical company, but a doctor cannot be because of ethical reasons. Because the issue is when you are testing your devices and you are implanting them in patients, there is a conflict of interest when you put your own device into a patient. So therefore, a doctor cannot come. So that issue needs to be resolved. The third very important thing is promoting startups. I think startups, not only from an external point, but the industry adopts startups. So what it does is it takes a startup and goes on supplying it. And please let me give you one very important piece of information. First of all, this DM PhD program was started for the first time in Sri Chitra. And the other very important point is that we have the highest translation output in the country, but it is only 30%, which means 70% of the products actually fail. And in all the state governments, it's about 3 to 4%, which means almost 97% of the products fail. And how can you increase this? You can increase it by actually adopting startups. And the industry can adopt startups which are relevant to them, support them for 3, 4, 5 years. If it works, it is fine. Then you can give them a choice. You want to join us? Please join us. If you don't want to join us, we'll keep supporting your startup company for the final translation of research. The third very important point is many states are doing it, MedSpark, which means that industry, medical college, and the engineering sections all come together to in an ecosystem which takes it. But please remember, because the regulation, any medical college that you make will take at least 15 years to actually be recognized. So it's not a simple thing. It's not like you just make a medical college and start collaborating on medical research. This is a myth. It won't happen very soon. Then the other very important point is the Indian systems of medicine need a rejuvenation. And what is happening is suddenly we are discovering that the West is discovering the Indian systems of medicine, we are not. And in these, we need to actually collaborate together to ensure that the Indian systems of medicine also come up in a big way. Then the other thing is, what is precision medicine? Precision medicine means that you are evaluating, geographically evaluating data. And based on the geographical evaluation of data, what you're doing is making it, say, for example, map-specific data. So which means supposing there is an outbreak of virus infection in one. Supposing you realize that, okay, it's only present in 2 districts and not in the third one. Then you don't have to seal all the districts. You only have to work on 2 districts. Supposing you find that there is stroke more in 2 districts, then what you can do is you can, with precision, implement health policies for various districts where an industry can come in a big way. Then the other important point is that on-site technology cooperation, which means that there are patients in very remote districts, and what the industry can help institutes do is to set up a protocol in which diagnosis as well as treatment done by local physicians in the primary health center who are in continuous consultation with the tertiary care hospital experts can really help the patients. And then triaging, shifting patients, when to shift patients, where to shift patients, and it's not like, oh, no bed available, so you're not coming, this is not from our hospital. All those problems will be solved. Then the other important point is, the 3D printing is a very important component. 3D printing means that you can make devices from 3D printing, but you can also make tissues in 3D printing. And tissues means now there's no need for, a time will come when you don't have to actually take out, harvest organs from one and pass it on. We also already have developed in Sri Chitra liver masses and everything, which we are hoping if we implant into at least animals testing now we are supposed to be doing. So once we do it, and then we'll see how the integration is, how the output is, whether liver actually functions or not. And even if the liver functions for 10% of its capacity, it's good enough. So this is a very important point. The other very important thing which industry can do is assessing field demands. I mean, there are so many demands coming from the field, and they're not coming back to the hospital simply because those field demands have not been looking. Then establishing incubation centers. This is a very important point. Then establishing central analytical facility. What is a central analytical facility? You develop one particular area. Industry says, okay, we adopt Sri Chitra, we give you a central analytical facility, which means several devices are in one area. So all scientists and engineers can come and utilize those instruments which are in one place. It's not like focused on different labs and all that. So you are kind of focused on that. And the other important thing is establishing many testing facilities. One of the bane of translation in India is the fact that not enough accredited testing facilities exist in India. And because of that, you just make a device, you take a patent on it, and then finish. It doesn't work any further. The testing facilities are not there, and this. And then the final point is organizing hackathons. Like, for example, you can also do, you give your problems, the industry gives problems to all the students here, organize a hackathon, and in these hackathons, you can have, say, this is our problem, how will you solve it? This is our digital problem, how do you solve it? So there are teams which will start solving those problems, and then the moderator can either combine all the solutions together, or take one individual solution, or take multiple solutions and combine them. So this is a very, very important point that needs to be done. And finally, two very, very important points which I need to focus upon. One is the government e-marketing. So it has come up in a big way. Every government institution is on a government e-marketing. But all the companies, multinational companies, are not on government e-marketing, okay? And they can easily come on the government e-marketing with local agents, but they are not doing it. And because of that, it creates so much of a problem for us, because we have to every month give statistics to the government of India on how much of government e-marketing purchase we have done. And if that doesn't happen, it becomes an issue. And the other very important thing is, there is so much of competition between players that when you do a tendering, the doctor is actually afraid. Okay, the doctor is actually afraid, because what happens is that there is so much of aggression between the different companies in trying to sell their products that you never get a constructive advice on tendering or what conditions to tender. When they give an advice, it is completely focused on their particular machine and not on any other machine. And this is a big issue which, from an end user point of view, I'm facing on a daily basis. So thank you so much for this.
Thank you, Professor Sanjay. My last question is the burning question from the academia. How to identify funding mechanisms to support digital health innovations and translations, which is the most important piece?
Thank you. So primarily we should see research as not an ad hoc, add-on activity, but as integral to whatever we are doing. Because what is research? Research is answering daily life questions that we are struggling with. Okay, in many countries, that is the norm. Okay, so if you have a clinical appointment, you also have about 30% of your time that is dedicated for you to do research. And unless you do that research and contribute to the furtherance of the science, you cannot keep your academic appointment. So primarily, I would say that it should be built. So while there are existing institutional mechanisms, for example, DBT, DST do have mechanisms by which funds can be accessed specifically for research and innovation. And the Bill and Melinda Gates Foundation, along with BIRAC, has the grand challenges, which is on a particular thematic area, specific questions. Basically, clinicians and others in the space come together and state the problem statements, and then a call for innovative solutions in that, and then matched in a slow and progressive manner, depending on the stage in which you are moving forward, that funding is available. And I would say the biggest opportunity is working with the states, because the states have huge amounts of questions to be answered, and they don't have capacity to utilize their budgets. So varying from 30% to 60% of centrally allocated budgets go back. So one fundamental first principles question that I would like to pose to the students here is that how can we make sure that financial flow through the system is really tracked and everyone responsible for their decision and held accountable. So if there is an allocation of 60,000 crores, okay, for Ayushman Bharat, okay, how do you reward states that are doing better than the others? Okay, today we are talking about let's have X number of cards and number of beneficiaries and all. We have to move to a stage where actually we use operational research, management sciences to see how this cash flow is happening and what are the bottlenecks and solve for them. So one thing that we from the foundation have been advocating with the Ayushman Bharat is to go for a green channel payment, just-in-time payment, and code as rule as code for payment. So if you have met all conditions, basically what you're doing. So actually computer science is very good at detecting signals from a lot of noise. Okay, as long as you have those signals to authenticate a payment, you should actually have the rest of the financial flow happen. So there is a lot of funding that is already held captive within the operational budget that should be leveraged. Second thing I would say is that we should see research as an integral part of the way we deliver work. Besides that, there are organizations of national importance. ICMR does have a regular program. They put out calls for centers of excellence. 5 crore budget over 5 years is given. Fairly decent amount of money to start up something, and then you can go on to that. Of course, Atal Innovation Centers and other things are there. And there are foundations and other. And the other thing that we have to keep in mind that increasingly with the growing economy of India, India is no longer eligible for a large number of international funding opportunities. For example, we are off the DFID, UK government no longer funds us. And soon, even we will move out of the World Bank, LMIC, or we are already out of the LMIC, we would not be eligible for many of the subsidies as a developing economy. We are an emerging economy, we're growing like really fast. So therefore, there is a call from the industry as well. No? If our economy is growing at that pace, industry also needs to collaborate with academia to have dedicated funding for research and innovation.
A last follow-up question. So these budding healthcare management students, how can they contribute to this digital transformation? 2 minutes.
Yeah. So my suggestion is that identify a problem, understand the problem fully well, and try to go to the depth of that. So I'll pose a few questions for you. Do we in this country know the birth weight by district across the country? Why is that important? Because you can have targeted intervention. You know what are the factors that are responsible for that. We talk about so much of digitization. A large number of children are actually born in facilities. Okay, their birth weight is recorded, but we do not know what the birth weight ranges are by district. There are more than 600 districts. A large number of them are aspirational districts, yet we do not have this. If today you have a medical condition that needs attention, where would you seek help from? Would you get an end-to-end continuum of care experience? Are there solutions that are offering that? Can you provide people with certain conditions with information that they can actually make decisions today, that is time discounting principle in economics, so that they can avert a stroke or a cardiovascular event later on in life? So all the best, go and make the best of it.
Thank you, Dr. Oman. Due to paucity of time, we need to conclude the panel now. We have exceeded 6 minutes. So the summary of both the panel discussions, we will circulate to all the participants and will be available in the GIM website. Thank you everyone. Thank you the panelists for the insightful comments and their presentations. Thank you.
It was an absolute pleasure and delight indeed. Thank you for such a thought-provoking session, everyone. We would like to extend our gratitude and felicitate the panelists. I request Professor Ajit Parulekar to kindly felicitate the esteemed dignitaries. Last but not least, we come to conclude this year's Healthcare Management Annual Conclave. We reflect on the insightful discussions, inspiring speeches, and valuable connections made. We thank our esteemed guests, renowned speakers, and dedicated organizers for making this event a success. The exchange of ideas and experiences have enriched our understanding of healthcare industry and its potential for growth and innovation. We hope that this conclave has sparked new ideas and collaborations that will lead to meaningful progress in field. I request Professor Sean, Associate Professor in Healthcare Management, to deliver a word of thanks.
I think no event is complete without acknowledging the help of all those who have worked tirelessly both behind the scenes and at the scenes to make sure that an event such as this goes as smoothly as planned. That's why I am here today. I'm here to appreciate those who have offered their services in one way or another to bring to light an event that was once just a plan drawn on paper. On behalf of the Healthcare Management Program, I stand here today to extend our gratitude to the many people without whom this event would never have come to fruition. We are honored to have had with us today our chief guest, Shri Vishwajit Pratap Singh Rane, Honorable Health Minister, Government of Goa. We thank you, sir, for consenting to our invitation and your guidance that you have given to this institute for the last so many years. Our heartfelt thanks goes to our Governor, Shri S. Sridharan Pillai, and our guest of honor, Dr. Professor Sanjay Bihari. Thank you for your kind words, for accepting and being a part of this particular event, and we hope to continue our association as we move forward. Our thanks also goes out to all our dignitaries who willingly accepted our invitation to be a part of this event as panelists, speakers, guests. Our gratitude to Mr. Sitij Kumar, Ms. Jayashree Kulkarni, Mr. Lalit Mistry, Dr. O. Manjanda, Dr. Ambuj Chaturvedi, Dr. Devlin Jeji, Professor Ganesh Ramakrishnan, Dr. Uman John, Professor Sanjay Bihari, again thank you, sir, who took time to share their thoughts and for their active participation in the conference. A very special heartfelt thanks to Mr. Anjan Bose, Anjanda as we fondly call him, who is an advisor to Goa Institute of Management. Anjanda took special attention in formulating the conference. His guidance was instrumental right from conceptualization, and of course, his presence is there in the execution as well. Thank you, Anjanda. Our special thanks also go out to Dr. Ajit Parulekar, the Director of Goa Institute of Management, Dr. Sumit Datta, the Registrar, the Controller of Examinations, Dr. Venkatesh, the Dean of Academics, and the entire governing board of GIM for always supporting our endeavors, for helping us brave new heights, and for being the pillars behind every event that is organized at GIM. The healthcare management program started as a dream, but today it has grown to become one of the top healthcare management programs in the country. This has been possible due to the dedication and commitment of Dr. Ajit Parulekar, who worked hard to create a healthcare program that would not just educate the young, but also mold them into becoming healthcare leaders in the various domains that they serve. Today, we are proud to say that so many of our students/alumni across years have risen to leadership roles, and we believe that many of them more will join us in such conferences going ahead. Thank you, Dr. Ajit Parulekar, for conceptualizing the healthcare program and for building a vibrant and a dynamic program over the last decade. We extend our sincere appreciation to the faculty, staff, and program coordinators of the healthcare management program right from its inception. Many of them are still part of it today, the part of the legacy of the HCM program. Many of us have moved on, but you are here with us. GIM is indeed proud to have had so many dedicated faculty and staff who toiled to establish groundwork for what it has become, a quality healthcare management program. Our distinguished guests, including our former faculty members, former staff, alumni, students, the Directorate of Health Services Goa, our partners, Know Your Healthcare Providers, KYHP, Give Goa partners, our esteemed recruiters, doctors, heads of various national and international health organizations who are present with us today here in this room and online, those who have come from far and wide, we are really grateful for your partnerships, endless support, and dedicated service. To the media groups present here today who have and still are capturing every second of today's memorable day, we thank you for gifting us with these memories which we will cherish forever. Of course, this is the new space that we operate in, and the IT team has worked really behind the scenes to make this all happen. No event is possible without the support of the members of the IT team. I thank Mr. Mukesh and his staff. Many of them are here and have worked tirelessly over the days to make this event a success. So thank you for all the technical support lenders, the lighting, the sound, the audio, video presentations. I think it was a day to remember. Our gratitude also goes out to Mr. Abhijit for coordinating various activities, without which we would not have registration. So registration kits, the preparation of the auditorium, brochures for delegates, distribution, and of course the coffee table book. Ashley, who has worked behind the scenes, who has volunteered for travel arrangements for the dignitaries. If you had a pleasant stay and if your flight bookings, tickets reached you on time, that's Ashley for you. Thank you so much. To the HCM alumni, we again extend our heartfelt thanks for sharing your messages, your photos, your profiles with the program and being proud ambassadors for GIM through the ages. Today, the HCM program not just celebrates this event, but today we celebrate another significant milestone at GIM. 10 years of the healthcare management program, 10 years of hard work, commitment, passion, perseverance, and excellence. The coffee table book that we earlier released today is a celebration of that journey of those 10 years. The book is a walk back in time that highlights the remarkable work done at the program since 2013. And it has been brought together by a dedicated team of faculty, staff, students, and a design team. I extend my thanks to all those who have spent time innovating, crafting a book that will be cherished for years to come. The design of this coffee table book is thanks to the design team at Branding that partnered with us. In particular, Mr. Floyd and Ms. Gale, who for the transforming work of the raw data and the images into a memory worth keeping. It's a memento of these fruitful years which we will cherish forever. I know there were mentions of the food, so to the caterers, K-Star, for preparing such delicious food and of course seeing the food arrangements done well. Mr. Raju, thank you so much for your hard work. Thank you once again for each and every person at GIM who has been working over the last months to set up this auditorium and which made it possible to host the conclave today. And of course, my dear students, thank you for all the work that you have done, the organizing committees. The POCs, the registration committee, the stage committee, the food committee, the conclave proceeding committee, the volunteers for taking care of so many small but still integral parts that went behind the scene to make today's HCM conclave possible and a success. A special thanks once again to my colleagues, faculty members, to the HCM program staff and all the research and academic associates and students. Thank you for being a part of the healthcare management program at GIM. And at some point of time or another, and for your valuable contribution that you made to the program, thank you so much. Finally, most importantly, we thank the Almighty for always being there for us each day and blessing us through these years, and especially in this conclave. Thank you.
Let's join for a photo here. Faculty, students, all of us have to be here. Come.